Hari Om, Namaskar. Welcome to you all. We are celebrating today World Breastfeeding Week by Independent Research Ethics Society, International Interdisciplinary Institute for Research, Education and Skills, as well as all of us, because this AYUSH Samriddji series is a tradition of knowledge sharing, brainstorming on unique topics related with the AYUSH. And today we are celebrating Breastfeeding Week. So today we would like to welcome Dr. Priyadarshini ji, welcome. Dr. Jagdishwar ji, welcome. Dr. V.K. Agnihotri ji, welcome. Dr. Parikshit Devnath ji, Dr. Mallikarjun ji, and Ved Jayesh Thakkar ji, welcome you to all. Today, I would like to request Professor V.K. Agnihotri ji, former professor and head Department of Swasthya, Uttarakhand Ayurveda University, for his valuable welcome address. Welcome, sir.
Thank you, Pawan Sharma sir. Namaskar and welcome to all. It's my great pleasure that we are celebrating today 416th webinar in the continuation for last 2 years. And the topic which has been taken today is of great value. No person living or had any life be scared from the mother milk. So breastfeeding is the topmost point to be discussed and to be noticed. So in this connection, as our Galaxy is here with the great speakers of their expertise, I welcome all these great guest speakers, and we do hope that this platform will definitely be enlightened with the eye-opening ideas because of their long experience. It's also a matter of pleasure that our the lady doctors are here, and they are not only the doctors, they have treated a lot of I think at least 2 to 3 generations, because I do hope that a person with a mother comes at the age of 1 month, 4 years, 10 years, or up to 12 years. Then he crosses the pediatric department, and then comes she herself become a mother, and then again and again. So at least 3 generations are being treated by these great doctors, and they might be having the best possible experience and utility and necessity of the breast milk as well as the breastfeeding. So as WHO is giving our instructions regarding the breastfeeding week right from 1st August to 7th August. So this webinar's focal theme is to manage and to enlighten, not only that, to make an awareness to all the would-be mothers, and past mothers to pay full attention regarding the breastfeeding. So it's a great topic to be discussed on today's webinar platform. So I welcome you all, distinguished guys, our great guest speakers, along with the platform guest floor persons like Professor Dr. Pawan Sharma ji, Dr. Roma ji, Professor Vishnu Sharma ji, and all the great guys. And without taking extra minute, I again welcome you all for their presence. And we do hope that great knowledge will be spread by your experience and your presence. You grace the occasion. Thank you so much. Thank you. Over to Dr. Pawan Sharma ji. Thank you. Namaskar.
Thank you very much, sir. Thank you very much for your kind blessings and inspiring words. So without wasting much time, I would like to request Dr. K.C. Priyadarshini ji. Dr. K.C. Priyadarshini ji.
Thank you.
Am I audible to you? Dr. Gunratne ji, kindly unmute yourself. Kindly unmute yourself. Yes.
Yes, sir. Yes, sir. Please share the presentation, sir. actually, this is a very happy time for me because again I got invited for the this seminar. So I welcome you all the dignitaries and all the participants today. And I think I am going to show another view of breastfeeding, if not another view of breastfeeding needs. Because if some woman or any lady having good health as well as good healthy breast, then only she can do proper breastfeeding. So she needs good health. Because of this, I wanted to discuss with you all what kind of problems, if not what kind of diseases affect the breast. Because if any breast problem is there, then she can't feed her baby well. So first of all, we just move through the simple anatomy. So can you hear me?
Yes, your
Yes,
slides
sir.
are, yes, your slides are shared.
Yes, sir. Please move next one, sir.
Introduction.
Yes, sir. Yeah, it's not moving, sir.
Yes,
It's not
it is.
moving. Okay. Introduction. Actually, the breast is on the upper ventral region of primates in left and right sides, containing the mammary glands. In a female can secrete milk used for feed infants. A modified sweat gland, lying on pectoralis, fascia, and musculature of chest
Madam,
wall and surrounded by. Sorry, sir, that PPTs are not moving. Sir, PPT is not moving.
Kindly tell me next slide in loud voice so
Oh,
I can change.
Okay, sir. Okay, sir. Go to first one, sir.
Sir, it is first one, introduction.
Yes, sir.
शर्मा सर
Huh?
हाँ सर हम लोग फर्स्ट स्क्रीन ओनली इज विजिबल सर प्लीज एनेबल एडिट
No, it is not coming.
sir we are getting the first only enable edit and then share so you can move the slides.
So then I'll start till that. The breasts are the most superficial structure in the anterior thoracic wall.
Now,
Yes, sir.
Man
Now,
and-
okay, sir.
Yes. The next one, sir.
Okay, madam. Okay, okay.
Both man and woman developed breast from the same embryological tissues. At puberty, female sex hormones, mainly estrogen, promotes breast development, which does not occur in the men due to the higher amount of testosterone. As a result, women's breast became far more prominent than those of women. Then I think you all can see what is the anatomy of the breast. It is made up of especially nipple, areola, and that lobules. They are all situated on muscles. Beneath of that, it is their ribs. Next, what is the architecture of the gland? Breast is composed of acini, which make up lobules. Aggregations of acini from the lobes of gland. Lobes are arranging in a radiation fashion like the spoke of a wheel and converge on nipple, where each lobe is drained by a duct. 10 to 15 collecting ducts open onto the nipple. Each duct drains a segmental system of smaller duct and lobules. Ducts are surrounded by connective tissues, which is characteristically loose and vascular in distal ductules. roundness of the organ is due to FAR, which fills gaps between portion of parenchyma. Each breast has 15 to 20 sections called lobes. They are arranged like the petal of a daisy. Each lobe has mainly smaller lobules, alveoli, lactiferous sinus, and lactiferous ducts in 2 to 4 millimeters in diameter. The lobes, lobules, and bulbs are all linked by thin tubes called ducts. These ducts lead to the nipple located at the level of fourth intercostal space, in the center of the dark circular pigmented area of the skin called the areola. Areola is rich in modified sebaceous gland and secreted oily lubricants to nipple and the areola. Why I am going to show this picture? As a doctor, while we are examining the patient, first we have to identify what are the problems on the breast. At that time, we have to documentate the thing, and according to these locations, we can understand various kind of breast problems. So here also we have shows the 4 quadrants of breast and axillary process in the lateral upper side. Then again, if you consider the part of the breast, you can see in the front, we can see the nipple, then the areola, and the lobules, then milk ducts, skin, likewise. First, we'll see the development in the utero. We all know the breast is not developing after the birth. It is started in the uterus even. The breast beginning to develop in utero around the 6th to 7th week of post-conception. It begins as a ridge of breast tissues running from the axilla to the groin, called the milk ridge. At about 8th or 9th week, the milk ridge usually subsides in all areas except above the pectoral muscles. That's why we are still calling milk line. Very rarely we can see extra breast or nipple or areola in the milk line. At about 16 weeks, the cells beginning grouping for the lactation glands of the breast called lobules. The underlying myology structures of the areola complex will beginning to form as well. Over the next several months, the inner workings of the fetal breast will develop and define. During the last 2 months, the lobules will beginning to produce and fill with the yellowish, clear, or sometimes oily, milky substance called cholesterol. This is a result of mother's hormones crossing the placenta during the last trimester of the pregnancy. Because of this, sometimes some neonatals, they are taken to the doctor and they are telling that the baby having some secretions on their breast, maybe in boys or maybe in girls. Then what kind of development will occur after the birth? After the child is born, the cholesterol will reabsorb or leach out of the child's breast through the nipple. Both genders develop colostrum and have identical breast structures until puberty. The mother's breast will also produce this colostrum for the first week or so, which is usually yellowish in color and considered very beneficial for the child to consume soon after the birth. And after the puberty, what will happen? Up until pre-pubescence, both genders' breasts are the same. At this time, the female body produces estrogen. Then progesterone, which stimulates the sexual nutrition process, which the ovaries are maturing, the breast undergo significant change themselves. The breast will enlarge and develop more fully for the time period anywhere from 3 to 4 years. Menstruation usually begins within 2 years of breast development. After functional maturation, the teens is able to produce milk supply in the event of pregnancy and subsequent childbirths. Then what kind of breast size? Actually, lot of they are having various problems with their breast sizes. They are telling, some are telling they are having large breasts, some are telling very small breasts, some are telling asymmetrical breasts. So what kind of facts leads to that breast size, that is amount of breast tissues, body fat percentage, hereditary, pregnancy, and age. After breast enlarged due to pregnancy, they will usually shrink in postpartumly called evolution. Then other changes, how it happened, because having breastfed, estrogen and progesterone supplements in the form of shots, then implantations, medications, hormonal disorders, menopause, and lastly, with the age. In old age, when skin thin, breast also lose volume due to the shrinking of lobules due to decrease in hormones. The dimension and the weight of the breast vary among women, ranging approximately 500 to 100 grams each. A small to medium-sized breast weighs 500 grams. A large breast weighs approximately 750 to 1000 grams. The tissues composition ratios of the breast likewise vary among women. Some breasts have greater proportion of glandular tissues than of adipose or connective tissues. In the course of a woman's life, her breast will change size, shape, and weight because of the hormonal body changes occurred in puberty, breast development, menstruation, pregnancy, breastfeeding of an infant child, end of the fertility. Actually, if you examine well, daily the female's breast will change. It will have some minor changes at least. Then what kind of things we can talk about? The symmetrical of the breast. 99.9% of women's breasts are not symmetrical. The breast have different volumes of different components, more tissues, less fat, large lobules, more connective tissues. Because of these reasons, their breasts are not symmetrically. The nipple may be smaller, perpendicular, erect, inverted, or very prominent. The areola complex may be large, small, non-extensive, one larger than other, be bumpy, have hair growth. Breasts are not usually perfect in nature, but with surgery, they can be made significantly more symmetrical. Symptoms of benign breast lumps, because most of the patients, they are observing their breast. Once they identify any lump, then they will go to a doctor. So we have to see what kind of symptoms of a benign breast lump. Then change in the size, shape of feel of the breast. Then dimpling, puckering or redness of skin, lumpiness, changes in the appearance of the nipple, discharge from one or both nipples, swelling or lump in armpits, that means axillary tail, then pain that does not get away in one part of breast or armpit. Then some are coming to the clinic with some nipple discharges. Sometimes they may be milky because of prolactinoma. Some are having green discharge because of mammary ductasia. Then black blood stain because of duct papilloma, and always uniducts all telling that is maybe mostly breast cancer. Then the thing is, normally we are asking that ladies to do the breast self-examination, because if you do the self-examination only, you can understand what are the changes. Then you have to start it around 20 years, and lifelong you have to do the breast examination, normally monthly. If still menstruation is there, the best time is after few days of the menstruation. If the menopause, then you have to pick a certain date, such as the first day of the each month likewise. If taking any hormones or something, then you have to talk to your doctor or consultant, and you have to pick a date for the examination. If I just brief how to examine the breast, then first you have to stand in front of the mirror that is large enough for you to see breast. Then check is breast for the anything unusual. First you have to see the appearance of the breast. Then you can see any unusual color, unusual shape, unusual swelling or something. Then watch closely in the mirror, clasp your hands behind your head and press your hands forward. Likewise, you have to change your movements and you have to see what happened to the breast. Next, press your hands firmly on your hips and bend slightly towards the mirror as you pull your shoulders and elbow forward. Do step 2 and 3 to check any changes in the shape or contours of your breast. Then gently squeeze each nipple and look for the discharge, because unless you squeeze the nipple, you can't see any unusual discharges. So you have to squeeze and see any discharge or something present or not. The breasts are best examined while lying down, because it spread the breast tissues evenly over the chest. Lie flat on your back with one arm over your head and pillow or folded towel under the shoulder. This position flattens the breast and makes easier to check. Then check with your healthcare provider if you find any change in your breast. Then changes may be developing of a lump, a discharge or or other than the milk, swelling of the breast, skin irritation or dimpling, nipple abnormalities, likewise. Then these are the things we have to see. This is the summary again. Then what kind of common diseases we can expecting in the clinic? Fibroadenoma, fibroadenosis, sclerosis adenosis, then traumatic fat necrosis, galactocele, mastitis, antibioma, ductal ectasia, gynecomastia in males, likewise, and carcinoma breast. Then we'll see what is the Ayurveda view of the breast. Actually, in Charaka, he has explained special sthana sampat, that means features of ideal breast. That is telling Nati Urdatva, then Nati Lamba, Nati Krishna, Vanati, then Yukta Pippalaka, then Sukha Prapana. Likewise, he has given the features of a ideal breast. Then what kind of sthana roga mentioned in Ayurveda? Actually, there's not that much direct references, but while I was collecting the rogas according to the books and according to patients in my clinic, I mostly got that sthana shula patients, sthana shopa, sthana granthi, sthana arbuda, and sthana vidradi. Actually, most of patients, they are having sthana shula. Mostly it is related with menstrual cycle. Very rarely, I got some patients, they are having sthana shula after the menopause even. And some having sthana shopa, but mostly I think they all leads to sthana vidradi or sthana granthi. At the first sight of their examination, they understood that they having that sthana shopa. At that time, they have come to the clinic. And the most of that previous diagnosis I mentioned in that allopathy way, we can take as in a one umbrella in a sthana granthi. And the sthana arbuda, we can correlate with breast in cancer in the breast. Then because of that, we are mostly getting granthi. So next one, yes, granthi. So mostly we have to do the granthi chikitsa for most of the problem. So we have to consider about the samprapti of granthi. The common granthi samprapti they are telling, because of that normal reasons of vitiated dosa, then it will vitiated mamsa, rakta and medas. Then it will lead, it mix with the kapha, produce round, protuberant and knotty and hard swelling. According to Dalhana, he has told something different than that. He also telling aggravated vata, pitta and kapha dosha. It involves only mams and rakta. It's not mentioned medas. Then according to the dosha, it will read vataja o, pittaja o, kapaja o, according to the dosha of the granthi. Then Samprapti Ghattak of Granthi. Then we consider that all kind of doshas, we can see the Granthi, but in Vidradi, it is mostly prominent with Pitta, and in Arbuda, if not in breast cancers, that Pitta contribution is very less. Then Dosha, Rasa, Rakta and Mansa. Then Agni, Jataragni, Datavagni, Mandya. Shrotas, Rasavaha Shrotas, Raktavaha Shrotas, Mansavaha Shrotas, and Artavaha Shrotas. Why that Artavaha Shrotas comes means it is, we can correlate with the hormonal changes. Then Shroto Dushti, mostly it is either Sangha or Atipravrutti. Then Udbhavasthana, Amapakvasha, Rogamarga Madhyama, Sthana Samshraya Sthana, Vyakti Sthana Sthana. Then what kind of concept we can use for the treatments? Actually, because of that aggravated dosha, we have to either remove or we have to do the Shamana treatments for them. So we have to do the Antar Parimarjana, if not that Sarvadahika treatments. Then for the local, if not the location, we have to do Bahira Parimarjana or local Dushti treatments. Then if that both fail, then we have to go for the Shastra Pranidhana, and along that we have to do the Nidana Parivarjana. Then while we are doing that management of each Sthana Roga, we have to follow the common regime. Wherever the treatments, we have to start mostly with Agni Deepana, because a lot of patients coming with the Agni Mandya. Because of that, they have started making Ama Tattva, then it has leads to the Sthana Roga. So next we have to do the Ama Pachana, then Shroto Vishodhana. Because while I was telling earlier, I told that mostly it may be Sangha or Atipravrutti. So if you want to solve that problem, we have to do the Shroto Vishodhana. Then Shodhana Karma, especially Nodu Karma or Pancha Karma. If they are having vitiated doshas, we have to do according to the situation, either Pancha Karma or other Shudra Karma. Mostly we can use Sneha, Sweda, then Udvartana, Virechana, if need Vamana Karma, Basti Karma, etc. Then we have to do the Shamana Karma and the Tarpana Karma. Granthi, Chikitsa. That means these all medications we can use for treatment for breast. If you see what kind of churna we can use, Gugulu Panchaka, then Trifala, then Arishta, Abhaya Arishta, Ashoka Arishta, Lodra Arishta, then Vati, Kanchanara Gugulu, Chandra Prabhavati. Especially we can use that both Vatis as a Lekhaniya Guna. Then what kind of Grita we can use? Induka Anta Gruta, Varunadi Gruta, Gugulu Tittaka Gruta. Then what kind of Sharas? Actually, we can use Shara also, but especially we can use Shara in Vidradi forms. I had a lot of Vidradi patients. First, they have come sometimes in Amavastha or Pachamanavastha. Then we have to turn that swelling to the Pakva Avastha. For that, we have to do some treatments. Then once it come with the Pakva Avastha filled with pus, at that time we have to do Shastra Karma. Then we have to remove all the pus and the capsule of the wound. Then at that time we can apply Shara. From that Shara we can do we can stop the blood and we can stop recurrence even, and we can heal the wound very fastly. So we can use Shara even for the treatments. So while we are commonly taking history and the physical examination of a patient, we have to do that questioning. With that questioning, we can ask symptoms, any other health problems, then possible risk factors for benign conditions or breast cancers or other family problems, any other things. And then we have to go for the examination. Then texture and the size of the breast, relation to the skin and the chest muscles, then lymph nodes, whether they have enlarged or whether any related problems in there, any tenderness or something is there. Likewise, we can examine. Then these are the symptoms of breast diseases. Mostly, we have to see as a doctor any lump present on the breast, then pulled nipple, then dimpling, dripping, redness, skin changes, etc. Then these are the modified multidisciplinary triple test, which is recognized in allopathic way. That is clinical examination, imaging test, and biopsy. That is pre-procedural diagnosis of palpable breast lumps. Here, what are the diagnostic modalities? Radiologically, mammogram, ultrasonography, magnetic resonance imaging, posterior emissions, tomography. Then what kind of pathological diagnostic things we can use? FNAC or surgical biopsy or tumor markers, especially ER, PR, HER2, etc. Then genetic studies. Sometimes we have to do the genetic studies even, that is BRCA1, BRCA2. Then serum markers, CEA, CA15, CA27, etc. For detection breast diseases, these are large number of investigations. Most of them are coming under CA breast investigations, because what kind of breast problems present, first we have to suspect whether it is a cancer or not. Then we have to first exclude the cancer situations, then only we have to start our normal treatments. Then investigation methods can be used for screening, diagnose, then finalize the treatments or surgery, detect metastasis, analyze post-operative conditions, analyze risk conditions, prevention, convince the condition, identify the prognosis. Then these are the investigations for carcinoma of breast, because in the world, the females may be a lot of suffering, the carcinoma of breast, but if they detected it is early, and their life time may be increased. Because of that, we have to consider about the investigation of carcinoma of breast. That is for the also mammogram, frozen section biopsy, true cut biopsy, white bore needle biopsy, ultrasound abdomen, estrogen receptor study, MRI, USG breast, FNAC, chest X-ray, CT chest, X-ray spine, excision biopsy, vacuum biopsy, etc. Then I want to show this because according to that breast quadrants, mostly we can see that breast cancers, mostly they are happening in the lateral outer part of, if not lateral upper part of the quadrant, but it is very rarely occurs in the medial lower part of the quadrant of the breast. Then this is the some pictures of some breast cancers, just you can see. Then we can see that tumor markers in each part, they are having specific tumor markers. So these are the breast CA tumor markers. I think earlier also I mentioned these all. Then conclusion, early detection of breast diseases help for save life, save money, proper treatments, reduce unwanted suffering. I think related this topic, I have to say, if you detected breast diseases and if you treated it well, then you can use your breast without any problems for good feeding, and you can be a good mother and you can make a good baby. Okay, thank you very much.
Excellent, very excellent, madam. बहुत अच्छा लगा. You have covered everything, I hope. So now, thank you. I would like to request.
Good evening, sir. Thank you, sir.
So I would like to request Professor V.K. Agnihotri ji, then Madan Thangvelu sir for their comments. And then Shilpa ji. I welcome Shilpa ji. Welcome.
Namaskar, sir.
Welcome
Namaskar.
on the platform.
Namaskar, namaskar, sabhi ko.
Namaskar.
Good evening to all.
Thank you. Thank you.
Good evening. Good evening.
Ji Agnihotri ji.
Thank you, Dr. Pawan Sharma ji. I was listening. Actually, I was just out in Honda showroom for the purpose of booking my new car. As you know, my car is not with me. I have sold out. So I was very much keen. Rather, the female assistant over here in this Honda showroom, I invited them to listen this guest talk. So it's my pleasure that Dr. Gunratne's voice is being witnessed by some of our Honda City's showroom colleagues. You very deeply touched the whole of the system, that what's the anatomy of that breast itself, or what are the our lactiferous tubules and how it works. So the influence of the hormones also has been well designed. You talked about the sizes, the nipple, the areola, and also this is all the say structural availability given by God. But we persons are a little bit fool to make more and more emphasis that these should be utilized as and when it comes under the right time. This is what your message is. So the World Health Organization conveying this message that the breastfeeding is at top. It has not got itself any alternative. Even the cow milk is to be diluted with 50% of water, boiled water. But this breast milk is so great that it has never been filtered. No added sugar is supposed to be added. It is never boiled. It is never stored. No feeder, no nipple, nothing. No top class hygiene is maintained by the government of God. So this is what the virtue and great blessing to the mankind. No person is alive without having the mother's milk. So greatness and my all benedictions, my all respect and regards to you all ladies, and we are here simply because of you. So my all regards to you. Thank you.
Thank you, sir.
Thank you, Dr. Pawan Sharma ji.
I welcome Dr. Madan Thangvelu sir. After a long time, sir. Welcome, 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 sir.
Pawanji, namaskar. First day of the 8th month of the year, August, and you have brought us together again. Today is a special day. It's the 30th anniversary, the 30th World Breastfeeding Week. And if I just take a moment to share some information here, it's open to everybody who can access the website. This is from the World Alliance for Breastfeeding with their office in Malaysia. And you can see here the facts and figures, how it is aligned to this, one of the 17 United Nations Sustainable Development Goals. If I quickly go through the information at this website, you can see how they have documented, starting with the first event in 1992, and all the details of events that followed on to where we are today, the 30th annual event, set up for breastfeeding. Educate and support is the theme for this year's week of celebrations. Now, it says educate and support, and I just want to highlight here one paper and the importance that can only be appreciated using some of the new information that we have. And this is about the benefits of immunity. This was never understood very clearly in the past, but now we have new tools, new research, all showing what and how you achieve this immunity when you do breastfeeding. And even I was a bit surprised when I looked at this information here. It says breast milk contains as many as 600 different bacterial species. And it refers to one paper here, which is a fairly recent paper. And then it talks about so many of the different bacterial species that are there. Now, on first reading this is surprising for everybody that there are such a large number of bacteria associated with breast milk. And then how these bacteria, along with other factors, help control the immunity of the newborn. And you can see all the fantastic work that is being done on this in this one area. So in terms of education, when we talk about education, it was difficult to explain to people what are the fine details, what is it that does and provides this benefit. And today we have information. This is a study that is put together by people from Mexico, and we congratulate them for doing this work. It's published in the Frontiers of Pediatrics. For those joining us on YouTube, if you Google the title of that paper, you can access that paper. It is available freely online. And for those here on the platform and who can see our chat, I put the link to this paper here. So it's a very important aspect of this education that we need to bring into all our education aspects in modern medicine, in Ayurveda, in the home science areas, the way we have colleagues today with us. So with those few words, I return the floor back to Pawanji. Shilpaji, namaskar. I think namaskar ji. Thank you for joining us today. My only comment here at this point, before I continue, is that somewhere we must bring that change in our education system where we introduce them to why this is important. And the rest, I think, will follow when you show them that there are some specific benefits that come from things that we didn't know before, but we were just told about it. A lot of people don't believe if you just tell them, just do it. They need something more. They need a little more evidence, little more something. I don't know what it is, but that information is coming through. Madam Gunratneji also mentioned about breast cancer and breastfeeding. There's a lot of information. I will share the screen later as we go into our talk, but I'll leave this now for Pawanji and Shilpaji. Shilpaji, namaskar. Thank you for joining us today. Very happy to see you here.
Yeah, definitely. Thank you.
Thank you, sir. Thank you very much. So now I would like to welcome Shilpaji, Professor and Head of the Department of Kriya Sharir, Solapur, SCR Ayurvedic College, Solapur. Welcome, welcome. Welcome on this platform. This platform is yours, not ours. This is yours.
Yes,
Please
of course.
Whenever you have any suitable topic in our plan, please join. Please join.
Yes, sir,
Welcome.
definitely. Thank you very much. Thank you very much, Dr. Pawan sir and Dr. Madan sir, and you are doing very well, sir, since last 2.5 years. I think this platform is running and you have also created a record, and congratulations for that same. And I'm just remembering some historical stories and some movies that in our Marathi, just now we have released our movies there, Hirkani. The Hirkani movies related with the mother and बेबी जैसे कि वो जो एक मदर होती ना, वो जैसे किले पर थी शिवबा के या शिवाजी महाराज के यहाँ, और उसका छोटा बेबी था, वो नीचे घर पे रह जाता है और रात हो जाती है और वो एकदम से व्याकुल हो जाती है अपने बच्चे के लिए, बट वहां पे इतना बंद हो जाता है किले का दरवाजा और वो पूरा जो फोर्ट रहता है ना उसको उतर कर और बड़े कुछ ऐसे कंडीशंस के साथ वो नीचे आती केवल अपने बच्चे के लिए। और रानी लक्ष्मीबाई के बारे में आप सभी जानते हैं कि वो एक फ्रीडम फाइटर भी थी और जिस बच्चे को लेकर उसने लड़ाई जीती थी, खेली थी, और ऐसे कई सारे तमाम सारे ऐसे एग्जाम्पल्स होंगे हमारे हिस्ट्री में। शिवाजी महाराज और जिजाऊ का है और कई सारे हैं तमाम। और मुझे लगता है कि ये बड़ा ही आज का दिन शुभ भी है, और जैसे हम लोग सभी यहाँ पर इस डे को सेलिब्रेट करें, बट जैसे हर साल अगस्त महीने में ये ब्रेस्ट फीडिंग सप्ताह, स्तनपान सप्ताह सेलिब्रेट किया जाता है। मानुषः पयः सर्वश्रेष्ठः। मानुष आयुर्वेद में देयर आर 8 टाइप्स ऑफ मिल्क, 8 प्रकार के प्राणियों का दूध वर्णन किया है, बट सबसे श्रेष्ठ है मानुषः पयः। और मुझे बताने में यहाँ पर बड़ी खुशी और गर्व महसूस हो रहा है। सबसे पहले तो जो ब्रेस्ट मिल्क बैंक है हमारे महाराष्ट्र के साई कॉलेज मुंबई महाराष्ट्र में 1989 में फर्स्ट मिल्क बैंक खुल चुका। जो भी वहां पर सारे सोशल कंसर्न्स थे, ऑर्गेनाइजेशंस थे, तो जैसे हमें पता है आज तो ऑर्गन डोनेशन, अभी ऑर्गन डोनेशन का आज ही हमारा मीटिंग हुआ, ऑर्गन डोनेशन के लेकर हम लोग प्रोग्राम्स करने जा रहे हैं। 13 अगस्त को ये प्रोग्राम होगा। तो ऑर्गन डोनेशन का जो एक पर्व चल रहा है पिछले 25-30 सालों से, बट उसके पहले भी जैसे रक्तदान के बारे में आप सभी जानते हैं, बट उसके पहले भी जैसे मुझे लगता है कि हमारी जो डेली नीड है, या जब कोई भी बच्चा दुनिया में आता है तो सबसे पहले उसको जरूरत होती है उसकी पोषण की। इस पोषण के लिए मदर्स मिल्क इज रिक्वायर्ड, एंड सो ये एक बड़ा पहल था। सायन आयुर्वेद कॉलेज या मुंबई में ये मिल्क खोली गई, बैंक खोली गई थी, जहां पर जो भी बच्चे जिनको माँ का दूध नहीं मिल पाता, या जिन माओं का दूध आता है बट उसके बच्चे नहीं होते हैं, वहां पे इसको कलेक्ट किया जाता है। उसके बाद आज मुझे लगता है देश भर में, हमारे पूरे देश में इस प्रकार के कई सारे बैंक खुल चुकी है। और आप डॉक्टर मदन सर भी जानते हैं कि यूरोप, अमेरिका में भी काफी सारे ये मदर्स मिल्क बैंक है। और मदर्स मिल्क बैंक को लेकर जैसे पिछले कुछ दिनों में हमारे गवर्नमेंट में भी, पहले तो 3 महीने का लीव हुआ करता था, प्रसूति रजा या प्रसूति की जो मैटरनिटी लीव हुआ करती थी, तो आज तो ये 6 महीना है। तो 6 महीना क्यों? मुझे लगता है इसके पीछे भी यही उद्देश्य था कि बच्चे का पोषण अच्छा हो। जैसे आपने अभी आर्टिकल शेयर किया, उसी के ऊपर मैं जाने वाली हूँ। आयुर्वेद में आर्तव स्त्रोतस का मूल स्थान के रूप में भी आचार्यों ने स्तन का उल्लेख किया है। स्तन एक महत्वपूर्ण ऑर्गन है और स्तन में 2 प्रकार के मर्म भी बताए गए हैं, स्तनमूल और स्तनरोहित मर्म है। और स्तन्यव स्त्रोतस, जैसे कि इसका डेवलपमेंट एट द एज ऑफ प्यूबर्टी स्टार्ट होता है। मैं जैसे मैडम ने इसके डिसीज के बारे में बताया, बट मैं नॉर्मल यहाँ पर एक फिजियोलॉजिकल लेवल से, और जैसे पूर्ण आहार के रूप में मदर्स मिल्क को मैं यहाँ पे प्रेजेंट करने जा रही हूँ। जस्ट आई एम शेयरिंग द स्क्रीन। ये पिक्चर आप कहीं पर भी जाइए, किसी हिस्टोरिकल प्लेस पर जाइए, मुझे लगता है वहां पर ये इस टाइप का कोई ना कोई पिक्चर आपको मिल जाता है। एंड सो दिस पिक्चर सेज मेनी मोर थिंग्स। ये पिक्चर बहुत सारी बातें बता देता है। ये माँ के हेल्थ के लिए, बच्चे के हेल्थ के लिए भी अच्छा और फायदेमंद होता है। आयुर्वेद में मदर्स मिल्क या स्तन्य, शुद्ध स्तन्य के लक्षण बताए, स्तन्य प्रवर्तन के हेतु बताए हैं। स्पर्शन, दर्शन, स्मरण से भी ब्रेस्ट मिल्क सीक्रेट होने लगता है, भले इसके पीछे हार्मोन्स हो। बट जैसे हमने देखा, हमारे पास कई पेशेंट्स आते हैं कि मदर्स मिल्क नहीं आ रहा है, बच्चे का पेट नहीं भर रहा है, क्या है इसके पीछे? हार्मोन्स तो है, बट ऑल्सो देयर आर some important few things are there. Emotions, बच्चे के प्रति प्यार, ये सबसे बड़ी भावना है माँ के मन में। बच्चे के प्रति प्यार हो तो नेचुरली ये मदर्स मिल्क सीक्रेट हो जाता है, जो कि बच्चे का पोषण सही ढंग से भी करता है। और ये मुझे यहाँ पे मैंने कुछ ब्रेस्ट फीडिंग की पोजीशंस भी शेयर की है, किस प्रकार से आप ब्रेस्ट फीड करा सकते हैं, जो कि बहुत ही हेल्पफुल होगा। जब पहली बार माता बनती है तो स्त्री को कई बार दुविधा होती है कि किस प्रकार से ब्रेस्ट फीड किया जाए, उसको अवेयर नहीं होती है वो किस प्रकार से किया जाए। सो दीज आर सम पोजीशंस कि जहां जैसे हम लोग इस पोजीशन को अपना कर भी अवेयरनेस निर्माण कर सकते हैं। ये पोजीशंस का जो इमेज है हम लोग अपने अस्पतालों में, कॉलेजेस में हम लोग शेयर कर सकते हैं। और इसके बारे में मुझे लगता है कि जैसे हमारे घर में दादी नानी होती है, और आयुर्वेद में धात्री की संकल्पना भी की गई है। तो जहां पर माँ नहीं होती वहां पर धात्री का दूध और धात्री का भी, जैसे बच्चे को कुछ यहाँ पे दुविधा होती है, बच्चे को कुछ प्रॉब्लम्स होती है, तो धात्री की चिकित्सा, धात्री का शोधन वमन विरेचक तक सूतिका अवस्था में। सो दिस इज द करेक्ट पोजीशन, जो कि माउथ कवर करेगा एरियोला का पूरा, और लिप्स आर फ्लैंक्ड आउट, एंड दिस इज द करेक्ट इन्फेंट लॉन्च ऑन पोजीशन। तो ये पोजीशन भी इंपॉर्टेंट है, जो स्टिमुलेट करेगी, और ब्रेस्ट मिल्क जो है प्रॉपरली बच्चे का पोषण होगा। जैसे आपने बताया कि नर्वस सिस्टम या जो हमारा ब्रेन है उसका जो पोषण होना जरूरी होता है इस पूरा ग्रोथ का जो एज है। आयुर्वेद में क्षीराद, क्षीरान्नाद और अन्नाद की 3 अवस्था बताई गई है। कई बार महिलाएं पूछती है कि कितना दिन स्तनपान किया जाए, तो मैंने हमेशा से बताया कि ये आपके ऊपर डिपेंड करता है, डिपेंड्स अपॉन यू। जैसे पुरातन प्राचीन काल में 1.5 साल तक, 2 साल तक भी बच्चे का यहाँ पे पान किया जाता था, बट जैसे कि आप 6 महीने के बाद क्षीरान्नाद, जहाँ पे आप अन्न एक प्राइमरी लिक्विड लेवल पर आप डाइट फूड देना स्टार्ट कर देते हो, तो आप धीरे धीरे रिड्यूस कर सकते हो मदर्स मिल्क को। और आप 1 साल 1.5 साल तक जैसे भी आपको मिल्क आता है उस समय तक आप इसको दे सकते हैं, दिया जा सकता है। देयर आर टाइप्स ऑफ ब्रेस्ट मिल्क। जैसे पहली अवस्था में 24 आवर्स, विदिन 24 आवर जो पहला मिल्क आता है उसको हम लोग कोलेस्ट्रॉम कहते हैं। इट इज वेरी रिच इन प्रोटीन। पहले तो ऐसे इसको निकाल दिया जाता था, इसको बच्चे को नहीं पिलाया जाता था, बट जैसे अवेयरनेस बढ़ा और इट इज अ ग्रेट सोर्स ऑफ प्रोटीन, तो अभी तो इसको पिलाया जा रहा है एंड इट इज सेड टू बी कोलेस्ट्रॉल। नेक्स्ट वन इज ट्रांजिशनल मिल्क, जिसमें थोड़ा कोलेस्ट्रॉल का लेवल भी होता है और जिसमें बाकी सारे कंटेंट्स भी होते हैं एंड विच इज आल्सो एक प्रकार का जो इसके प्रॉपर्टीज है, दे आर लाइक सेम। यहाँ पे मोर ज्यादा स्नेह मात्रा होती है, फॉर मोर फैट इज देयर इन दिस एंड लैक्टोज इज देयर आल्सो। सो ये थोड़ा मतलब एक it has some water soluble vitamins also, and the next stage is natural milk, जो mother's milk जिसको हम लोग कहते हैं। So these are the 3 stages of mother's milk, and this is just a picture I have shared with the bank, mother's milk bank, जो मुझे लगता है आज की बड़ी जरूरत है, क्योंकि वर्किंग वुमन होती है। और मैं यहाँ पे इस मंच के माध्यम से ये भी कहना चाहूंगी कि हर जो भी वर्किंग ऑफिस है, हर कोई भी अस्पताल है जहाँ पर लेडीज वर्किंग होती है, कई बार ऐसे देखा जाता है कि महिलाओं को प्राइवेट जॉब्स होते हैं तो उनको छुट्टियां नहीं मिलती है, तो उनको ज्वाइन होना पड़ता है ड्यूटीज पे। तो बच्चे का पालन पोषण कैसे हो, इसको लेकर भी उसके मन में कई सारे ये होता है। तो मैं यहाँ पे रिकमेंड करना चाहूंगी कि हर अस्पताल, हर जो भी वर्किंग प्लेस है, वहां पर एक कोई भी क्रश, पालना घर या ऐसी सुविधा हो जहाँ पर माता अपने बच्चे को दूध पिला सके और उसका पोषण अच्छे से हो सके। तो ये भी ये आज की जरूरत है। मुझे लगता है हम लोग बाकी सारी सुविधा तो दे रहे हैं, बट इसके साथ जैसे हमने बीच में पढ़ा था कि हर गवर्नमेंट या हर सेक्टर में आज जिम खुलेंगे, जहां पर जैसे 8 घंटा 8-10 घंटा जॉब के लिए बैठना पड़ता है, तो जो एक्सरसाइज नहीं हो पाता है, तो जैसे बीच के समय के लिए जिम्स खोले जाएंगे, उसी प्रकार से ये भी एक जरूरत है। और मदर्स मिल्क को लेकर जैसे मैंने बताया कि आयुर्वेद में स्तन्य दृष्टि के 8 प्रकार होता है, वातज, पित्तज, कफज, सन्निपातज, रक्तज वगैरह वगैरह। जैसे वातज में फेनिलता होती है, रुक्षता होती है, पित्तज में दाह होगा, कफज में तंतुलता होगी। आयुर्वेद का ये जो स्तन्य दृष्टि को लेकर हमने कई सारे पीजी पीएचडी के इसमें काम किए गए हैं, जिसको लेकर काफी सारे रिसर्च पेपर भी पब्लिश किए हैं। आयुर्वेद में स्तन्य दृष्टि या स्तन्य के व्याधि, जैसे मैडम ने अभी अर्बुद को लेकर बताया, और अबनॉर्मल सिक्रेशन के बारे में भी बताया कई बार। लाइक देखिए, मिल्क सिक्रेशंस, कुछ बेबीज को भी मैंने देखा था कि उनके निपल से भी ब्रेस्ट मिल्क या कुछ सिक्रेशंस आते हैं। तो अलग अलग आयु के स्टेज में देयर आर सर्टेन सिक्रेशंस। तो कई बार प्यूबर्टी के एज में भी 1-2 ड्रॉप का सिक्रेशन हो जाता है। फीडिंग के दौरान तो होता ही है। मेनोपॉज के केसेस भी आते हैं जिनमें ब्रेस्ट सिक्रेशंस होते हैं। सो वी हैव टू गो फॉर इन्वेस्टिगेशंस, मैमोग्राफी, मैमोसोनोग्राफी, एंड उस जो भी कलर होगा उस ब्रेस्ट सिक्रेशन का, प्यूरलेंट है, रेड है या पोस्ट डिस्चार्ज है, वेदर इट इज क्लियर, ये भी हमें देखना पड़ेगा। और इसके हिसाब से, और हर बार मिल्क सिक्रेशन या कोई सिक्रेशन होता है तो इट इज नॉट अ कैंसर। देयर आर मेनी फिजियोलॉजिकल कंडीशंस। डक्टस एरियोलस करके कंडीशन होती है जिसमें जो डक्ट्स होते हैं वो ओपन हो जाते हैं, जिसके कारण भी सिक्रेशन आ सकता है। सो दीज आर सम। और मैं थोड़ा सा आयुर्वेद के परिप्रेक्ष्य में सूतिका परिचर्या में भी बताना चाहूंगी कि जैसे कोई भी माँ, या जैसे आयुर्वेद में भी क्या जो बताया गया है, नुस्खे बताए गए, कई सारे सर्टेन टाइप्स ऑफ फूड्स आर देयर। और सूतिका परिचर्या के हिस्से में ये आता है कि माँ का जो दूध है उसको कैसे हम लोग प्रवृत्त करें, और व्हाट आर द फूड और व्हाट आर द मेडिसिन विच आर बेस्ट फॉर द लैक्टेटिंग मदर। लाइक शतावरी के बारे में आप सभी जानते हैं, और शतावरी, अश्वगंधा और जीवनी गण के सारे जो भी द्रव्य है, दे आर वेरी मच बेनिफिशियल एट दिस स्टेज। और नेचुरल फूड में फेनुग्रिक सीड्स आर वेरी गुड, और हम लोग फेनुग्रिक सीड का वाटर बनाकर जैसे उसको 4-5 घंटे के लिए भिगो देंगे, एंड देन आफ्टरवर्ड्स स्मैश करेंगे, और फिर हम लोग उसको छान कर इसका जो बनता है वाटर, इसको हम लोग दे सकते हैं। देन जीरक, क्यूमिन इज ऑल्सो वेरी गुड, और क्यूमिन का बना सौभाग्य शुंठी पाक, जीरकाद्यारिष्ट, गुड़ जीरक, और जीरका जो भी सारे जीरक के या अजमोदा या जीरक का जो भी चूर्ण आता है, इसको भी हम लोग गर्म पानी के साथ दे सकते हैं। सो ऐसे कई सारे हैं जो घरेलू नुस्खे हैं, या फिर जैसे कहा जाता है कि दूध पीने से भी दूध बढ़ता है। सो आई सजेस्ट वंस अगेन, जो माता होती है उसको भी दूध पिलाया जाए, गाय का दूध अगर मिले तो वो भी अच्छा रहेगा। और जहां पर भी संभव नहीं हो पाता है, मदर्स मिल्क नहीं आता है, तो इमोशनल अटैचमेंट बहुत ज्यादा इंपॉर्टेंट है। वहां पर आप लोग जो बैंक्स वगैरह है उसका भी सहारा ले सकते हैं। सो मुझे लगता है मदर्स मिल्क या ब्रेस्ट फीडिंग जो हम लोग सेलिब्रेट कर रहे हैं एक अवेयरनेस के रूप में, और अवेयरनेस काफी हद तक जरूरी भी है। ऐसे प्लेटफॉर्म्स को लेकर आपका ये बड़ा अच्छा पहल है मुझे लगता है। तो ज्यादा डिटेल में ना जाते हुए मुझे आज यहाँ पर इस ब्रेस्ट फीडिंग वीक के इस प्रोग्राम में आमंत्रित किया, उसके लिए मैं आपका बहुत बहुत आभार व्यक्त करती हूँ। और मैं फिर से एक बार कहूंगी, मानुषः पयः सर्वश्रेष्ठकरः, और इसका कई सारे रिसर्चेस भी हो चुके हैं, और जैसे सर ने भी बताया, मदन सर ने, कि इसमें जो भी सारे कंपोनेंट्स है, कंस्टिट्यूट्स है, एंड दे आर रियली गुड। और जो कि ना केवल लाइक हमने देखा कि जो ऊपर का दूध होता है या कई बार फेरेक्स, सेरेलैक वगैरह का सहारा लिया जाता है, बट फिर भी इम्यूनिटी कम होती है, या जैसे डायरिया, डिसेंट्री या इंडाइजेशन की समस्याओं को बच्चों को जूझना पड़ता है। तो जितना संभव हो चुके हम लोग मदर्स मिल्क को ज्यादा से ज्यादा बच्चे को पिलाए, जिसके साथ उसका सारा जो, और हम लोग मराठी में कहते हैं, आप हिंदी में भी कहते होंगे कि कुछ बात हो जाती है तो हम लोग कहते हैं कि माँ का दूध पिया है, या तो माँ का दूध पिया है। क्यों इसमें यहाँ पे इट्स नॉट कॉमेडी या यहाँ पे कुछ मजाक नहीं, बट लाइक सीरियसली यहाँ पे ये बात होती है कि माँ का दूध पिया, यानी वो बात ये है कि माँ का दूध आपके लिए इतना अच्छा, या इतना इट इज द बेस्ट पावरफुल, सुपर पावरफुल इसको हम लोग कहेंगे। तो इसीलिए क्योंकि इसमें सारे न्यूट्रिएंट्स है, इसमें इम्यूनिटी भरी हुई है, इससे आपका पोषण होता है, ये जीवनी है, ये मधुर है, ये साथ में है। तो इसीलिए हम लोग इसको इस प्रकार से बोलते हैं, बट इसका मतलब होता है कि इसमें सारा कुछ मातृत्व, या इसमें सारा कुछ प्यार है और इम्यूनिटी है, सब कुछ है, जो भी आप चाहते हैं अपनी जिंदगी के लिए, वो सारे आपके न्यूट्रिएंट्स इसमें भरे हुए हैं। तो मानुषः पयः सर्वश्रेष्ठः, इसी के साथ यहाँ पर मैं अपना जो वक्तव्य है यहाँ पर मैं रुकती हूँ। आभार आप सभी का, धन्यवाद, थैंक यू।
बहुत बहुत धन्यवाद शिल्पा जी, आपका बहुत बहुत धन्यवाद। आप प्रखर वक्ता हैं, माँ सरस्वती का आपके ऊपर आशीर्वाद है।
इंश्योरेंस ये आपने इंश्योरेंस इतना बोला था, डिस्काउंट कहीं से निकालना है सर, वो मेल।
थैंक यू वेरी मच। मदन सर।
शिल्पा जी बहुत बहुत धन्यवाद। You have given us a wonderful overview. आप what you said about महाराष्ट्र, अगर एक सवाल पूछें आपसे जी, थोड़ा और बताना महाराष्ट्र में क्या है आप लोगों की
yes,
परंपरा जो
किसको लेकर सर, ब्रेस्ट मिल्क को लेकर?
नहीं, the whole practice जो आपने you identified correctly, आजकल the pressures on people, mothers, so they don't get time to spend with the children. यहाँ भी they get only 6 months. फिर उसके बाद everybody, if you are a working mother, you have to go to work. अब उसके लिए सुविधाएं, what facilities are made available there in Maharashtra, not only in the big cities, Bombay जैसे शहरों, yeah, but also in the slightly smaller metros. काफी है महाराष्ट्र में। और एक चीज और, what is happening in the university-like environment? थोड़ा सा, एक तो क्योंकि a lot of women are now working in the universities, they are also having children. उसके लिए कुछ, is there anything special? यहाँ पे जी, by the 6th month, everybody has to go back to work, women. और उसके बाद there is a creche here. And the creche, in an average creche, daily payment is £50. 5,000, अगर इसको convert करें, it's about 5,000 rupees for looking after the child from 9 o'clock to 5 o'clock. And that means you need, if you have a child, you need at least one complete salary. So one person's complete salary has to go just for that creche. अब महाराष्ट्र में क्या है जी, आपके उस तरफ क्या कुछ है? Because this is
जैसे महाराष्ट्र में, जैसे मैंने बताया, ब्लड बैंक, ये मिल्क बैंक तो है, बट जैसे फिजिबिलिटी अगर देखी जाए तो हम लोग, या जैसे मैंने देखा है कि ऑब्जर्वेशन मेरा ये है कि जहां पर भी वर्किंग मदर होती ना, तो वहां पे उसके ऑफिस से उसको थोड़ा सा कंसेशन मिल जाता है। आफ्टर 3 to 4 hours शी कैन गो एंड शी कैन फीड। और कई बार तो ऐसे भी देखा है मैंने कि देयर आर सम लाइक कुछ वहां पे ये एरिया होता है और वहां पर भी बच्चे को लाया जाता है, उसके घर का कोई भी हो। और सर हमारे महाराष्ट्र में ये परंपरा होती है ना कि लाइक घर के जो भी सुपर पावर लेडीज होते हैं, नानी दादी और जो भी है, चाची जो भी है, तो वो रहते ही है 1 साल तक तो बच्चे के माँ के साथ कोई ना कोई, देयर आर समथिंग, देयर आर कोई भी ऐसे रह जाता है। तो क्योंकि बच्चे को लेकर सभी ज्यादा इमोशनल होते हैं, और आजकल तो 1 या 2 बच्चे होते, सो ऑल आर प्रेशियस बेबीज, सो उसके लिए तो टेक केयर बहुत ज्यादा होती है। और ये मैं रिकमेंड करना चाहूंगी कि यहाँ पे एक्चुअली ऐसी सुविधाएं सभी जगह हो। और जैसे आपने बताया क्रश को लेकर, तो क्रश तो है ही, हमारे यहाँ भी है ऐसे टाइप के, बट इतना चार्जेस तो नहीं है। मिनिमम थोड़ा सा इतना हाई चार्जेस तो नहीं होता, मिनिमम चार्जेस में भी मिल जाते हैं। बट लाइक ब्रेक होता है ना लंच टाइम में, शी कैन गो होम एंड शी कैन फीड द बेबी। और फिर धीरे धीरे आफ्टर 6 मंथ ऊपर का थोड़ा खाना भी स्टार्ट कर दिया होता है, जैसे आचार्य भी कहते हैं ना, क्षीरान्नाद अवस्था। और मुझे लगता है, बट स्टिल सम emotions are much more important.
इसमें, if I can, one last question, Shilpa ji, ये just a little bit about this herbs that are recommended. आपने जो बताया, one last question. We can leave that question till the end. I don't know if
फ्लो
Shilpa
टूट
ji is
जाता है ना
busy.
सर, स्पीकर्स का फ्लो टूट जाता है।
चलो जी. I don't know if Shilpa ji is busy, whether she has
No,
time
no,
to
sir,
spend
it's
with
okay. No, it's okay, it's okay, I can.
यहाँ पे रिसर्च की बात की, शतावरी एंड ऑल दीज थिंग्स, इसके ऊपर थोड़ा रिसर्च की सोच लगानी है जी, that we must get our students to think a little bit how to do some systematic research, क्योंकि आजकल they are saying immune system के ऊपर फर्क आती है etc. So when we look in our ancient textbooks, there are some recommended herbs that you take, not only galactogogues but some other herbs, and that can only be understood with a deep study of our textbooks. So that is the point. We will come back to this.
Actually, shatavari can be given during pregnancy. गर्भिणी परिचर्या में भी इसका उल्लेख आया है. And गोंद is also one compound. गोंद के लड्डू या गोंद खिलाई जाती है, जो कि बहुत ही अच्छे से काम करती है. And अत्तसी बीज are also great. They are also superfood for milk secretion.
Thank you जी. ये last वाला, please put this in, Shilpa ji, please put that, ये जो बीज की बात आपने बताया, please put that in the chat.
Yeah, I will put in the chat box. Yeah,
thank you जी. Thank you.
Yes, sir. Yes, thank you.
Thank you again, Pavan ji. Namaskar.
Thank you, sir.
Thank you, सभी का आभार.
Today we have two special guests with us, sir, from Northeast Assam.
Agriculture University.
Yes, they are from Agriculture University. I am really grateful to Professor Vishnu Prasad Sharma ji, who has recommended these two names. I would like to, before welcoming Dr. Manisha ji, I would like to communicate one thing, sir. Just today I have returned from Varanasi, just today morning. Tomorrow is Charak Jayanti. So again, we are celebrating Charak Jayanti in grand way. We are providing Charak Shiromani Samman to Professor Banwari Lal Gaurji, a legendary personality who has written Tika on Charak Sanhita and so many books, and Vaidya Tapan Kumar from Ahmedabad, because she calls Charak Sanhita as his girlfriend, and he communicates the various strategies to recite and remind that Charak Sanhita. So 2 persons we have selected, and 3 speakers will be there. Professor Bijresh Mishra, Head of the Department Sanhita and Siddhant, Nagpur. Vaidya Parul Joshi ji, she is with us today also. And Vaidya Bhupendra Mani Tripathi ji, he has also done very extensive research on Charak Sanhita. Topic is Charak Sanhita Principles for Practice. And not only this, sir, we are celebrating Charak Fortnight celebration. So every day from 8:30, we will be calling 2 speakers on Charak Sanhita for next 15 days regularly. So that will be a series on Charak Sanhita for Charak Paksh fortnight celebration. What else we can call, sir, fortnight celebration? Do we have any other definition?
No, this is good.
Fortnight celebration.
It is very good. I only wish, Pavanji, that we can advertise this a little more, because there are so many scholars there who can give us. आज हमारे पास एक message आया जी. If you want to understand any disease, you should understand Jwara. If you are confused about anything, start studying Jwara. So this is the training these people had. And we want our young students to be told.
All 30 speakers will be young, sir, on Charak Sanhita.
Yes.
So we are searching new Pratibhaj in our India. Thank you. New talent and caliber. Thank you. Thank you. Thank you very much.
Thank you.
So new talent is with us. Dr. Manisha Chaudhary ji, welcome, welcome, madam. Madam is from College of Community Medicine, Agriculture University, Assistant Professor, Department of Food Science and Nutrition. Welcome, welcome, madam. Now stage is yours. Thank you for joining.
Thank you, sir. All of you, seniors, and I have selected stop. So actually today was the television or college are still in the college, working hard for making this event fun. So, but before joining academics, I just want to take about myself first. Before joining academics, I developed a strong type, and I spoke state save the children, such organizations, and worked for quite a long time, and on the breastfeeding, also on the child nutrition. So I just Sarah has just asked us to the names, so we have our names, but I don't know that we selected for the talk. Still morning I called Sarah. And he's just get ready for the presentation.
Manisha ji,
So,
your signal is a bit disrupted. Is there,
yeah,
I don't know if it is the network or if it is the position of your microphone, ji.
and I'm connecting from mobile actually.
Okay.
Not
you're
mobile. Mobile means mobile network.
Thank you. Maybe if you're, thank you. Let us continue. We will.
Yes, yes, sir. So today I'm just I want small team of World Breastfeeding and also on hospital initiative, which is the main teams at breastfeeding. I am one of the central this time ahead. And so I would like or first slide with sir.
Thank you, Manisha ji. Maybe if you, Manisha ji, if there is some way to turn your camera off, maybe you will have a little more bandwidth, then we'll be able to. If you can. If it is possible to turn your camera off, then maybe we could be able to hear you without. If you're, thank you.
Is it clear now, sir?
Much better, thank you.
Okay.
And could we have, thank you. Thank you, Manisha ji, thank you.
So, so this year the World Breastfeeding, the main team said baby friendly. Now it is breastfeeding friendly hospital initiative. How we can make the hospital breastfeeding this year, and this time private hospital. See a lot of involved starting initiative like the Malnutrition. I was also started certification of certification government hospital. Now it's made private then other maybe private hospital. So this year the breastfeeding action is the this is the so I'd like to struck stages of analysis that see the expired analysis. I'm also at Assam. So almost all the states have done down the have so the state compared just 4, it's 5. See, for example, early initiation of breastfeeding is around, but now it is stagnant as 40% on. Assam is 60% of initiation of breastfeeding. Now it is 9%. So for a similar exclusive breastfeeding also status is also not expired. So see around 88% of institutions, 8% of the children are born in. So the institutional delivery percent, but the early initiation of public see institution itself breastfeeding practices are not. See, of the are hospital. Hospitals is doctors, nurses, paramedics, and but still not situation of same situation or same all of us. So this is the written reason breastfeeding in hospital. Strive hospitals, but also so then early initiation of breastfeeding is choose for using the and the so then so this is see our institutional data early initiation of around 8%. So,
Manisha-ji, I wish
yes.
to interrupt your flow. Your audio signal is still very, very broken and disrupted. Is there some way we can solve this? I can see Professor Sophie from Bangalore is commenting on this also. Sophie Saab, namaskar. Let us see if we can solve this. Maybe Pavanji can give a solution for this because you have so much. You have a lot of.
Speaker is there. Yes.
Sir, 1 minute. Let's try to.
Yes, kindly continue.
And connection.
Because you have a lot of very valuable information in your slides. So if you, without your voice, it becomes a little difficult for us to appreciate. Apologies for this. Manisha-ji, I don't know if it'll help if you tried without the microphone.
Okay.
Maybe the problem is with the microphone.
Hello?
Yes.
Just connecting my LAN connection. I'm just taking some.
Thank you. While we wait for Manisha ji, I want to welcome everybody who has joined us today here. I can see a lot of new people. Professor Vahia Begum ji, namaskar. Sophie Sab, namaskar. Renisha ji, Kashyap ji, namaskar. Thank you for joining us. Sophie ji, namaskar. Thank you for joining us today from Bangalore. Parul ji is also here. Parul ji, namaskar. I'm curious to know a little.
Manisha ji.
Parul ji, pranam ji.
Yes, sir. Good evening and pranams to you also, sir.
Hello.
Namaskar ji. Very happy to have you here with us.
Am I audible,
Yes,
sir?
Manisha ji.
Haan ji,
Yes.
Manisha ji, we can hear you now. Thank you. We should have checked this connection a little earlier, but apologies for this, but we will get this.
So, we're discussing about the status of early initiation of breastfeeding institutional states, and so as the institutional delivery is 88%, if our early initiation of breastfeeding is also should around 8%. In one side, we are institutional delivery where all the staffs are qualified. So about breastfeeding preferences. That self problem is lying. So hospital try them just till orientation staffs is possible, and that breastfeeding should be done. So for the breastfeeding team is to pay attention to policymakers and managers. Yeah, and also to encourage the hospitals to adopt breastfeeding friendly practices and to educate the health and the lactation management skills, counsel and support. This can be, and so the main objective is to initiation of breastfeeding, facilitate the access the hospital assessment and monitor private hospitals with services, and analyze and provide certificate accreditation of the hospitals to adhere to standards valid the external assessment, and and to provide the technical advice and support of the hospital for strengthening breastfeeding. So cesarean.
Manisha ji, we
Yeah.
have lost your audio signal again. I don't know how to solve this problem, because you have so much information that we would all like to hear, but somehow your audio signal, perhaps.
I'm not on my decks. Otherwise, I could have connected to LAN. I'm in the all the colleges closed actually. We are just LAN connection. Is it audible now? No.
Yes, please continue. If we will see if we can improve on.
Am I audible now?
We can hear you. Yes.
Okay. Okay. So next, there are 10 steps to be followed in case of to make the hospital baby friendly. So first is there should be a breastfeeding policy, and the hospital should not encourage the promotion of companies' artificial milk campaigns, and hospitals, the health workers and the providers should train and oriented on the breastfeeding. And also there should be a room in facilities in the hospital, so that after delivery the baby should be kept to the mother only. And staff competency and the care of care during right after birth. Support and skill support is required for successful breastfeeding in case of mothers. So that should be, then the counselor should be there. If there is no prominent counselor, the other healthcare providers may be trained on counseling, lactation counseling, and they can support the mothers. So there is some national guidance as per the MA procedure. Most of us will. MA is also this is also mother's absolute affection. The full form is MA, that's mother's absolute affection. This is nothing but the promotion of breastfeeding and also promotion of IMS Act. But we have seen in most of the states, the IMS Act is not followed properly. In Assam, we had trained the food service, food supply inspectors and joint directors on IMS Act. It was successful, and if the healthcare providers and also the authorities can be trained on IMS Act, and the hospital authorities should also be trained on this act, then the wrong practices by the companies can be stopped. So this year the mainly as per the WHO 10-step guideline, the baby-friendly hospital in breastfeeding-friendly hospital initiative that is there to certify all the hospitals where the mothers can successfully breastfeed their children, babies, and also to make a proper environment for breastfeeding. So there are different evidences for breastfeeding friendly hospital initiative. So if we can make the hospital breastfeeding friendly, then the indicators will definitely. So there are different evidences also. So some of the tools have been developed by BPNI and they have been standardized. The support from WHO, UNICEF, and other experts. So those tools can be used for making their hospitals baby friendly. First, there are a few steps. It's almost finishing my slides. There are a few steps. First is a self-assessment. Have to do self-assessment. So there is a package of near about 5,000 is required for the expert to, expert from the BPNI. Because it should be fill up in the online portals, so that can be done with the technical guidance from BPNI. So there is a website here. I can write down this website, or you can get it get it easily at the BPNI website. So after self-assessment, if the hospitals get more than 60% or 56% marks, then the external assessment can be done. So external assessment with the help of experts should be done, and this is should be carried out. The independent assessors authorized by the BPNI should use. There are a list of authorized assessors in the different states in the country, and those can be used for final external assessment. So here also some of the fees for the very nominal fees. These are the nominal fees for the external assessor. If some of the fees he must be required to the hospital and for travel and all, there is a very minimum cost. So with the help of this, the hospitals can easily get the support from the and other assessors, and they can certification process start. So after self-assessment, following areas would need utmost attention, like data management and monitoring. That can be done by the PNI portal, policy and governance, then skill training of the staff to the competence. So these are some of the preparation required for accreditation. Then these are the this is the process of hospital assessment. If you can see, application to NAC, then payment, then conduct the self-assessment, then technical advice, then apply the external assessment, then NAC appointment and external assessment. Like this, there are a few steps the hospital's authority can, and the certification is this kind of certification. Certification is to be given to the accreditation certificate is to be given to the hospitals if they attain the score for certification. So this is one of the examples, friendly hospital of the name of the hospital. Right? So then the accreditation is there for 3 years. So after 3 years, the hospitals again have to do the same process and the accreditation. So what are the benefits of the accreditation? Moms and babies obviously are getting the highest quality of care, best quality of nutrition for the best start in life. Then for the hospital, the accreditation stimulates the continuous improvement to the benchmark of the hospital the best, and also enables the hospital to demonstrate its commitment and the quality care and raise. Continuous learning, leadership and this process, then it improves the professional development of staff and stimulates the quality. So all this help is also helpful in making market. Yes, of mainly. Hello.
Manisha ji, we lost your signal in between.
Okay, so shall I go to the slide again, or what to do, sir?
Oh,
only one slide is left.
thank you. Please let us see your last slide, because you have prepared such wonderful slides with so much information. Unfortunately, the signal was a bit choppy. Maybe we will see your concluding slide.
Yeah, I'll share the slides with sir, then sir can also get it.
Thank you, Manisha ji. So, thank you.
So this is the web platform of BNI, where we have to apply for the hospital registration and accreditation. So here are this is the process for the whole process. So all are available. This is the link and my contact BNI. So this is all about the BFHI, how we can the hospitals accredited on BFHI. And I just like to say, so during this World Breastfeeding Week celebration, we should always be focused on the successful promotion of breastfeeding in all platforms, not only in like have to hit all platforms. That as per my like, because people know it, but somehow they are not following. I always see one thing because of Assam. If you see, we are flood affected. Most of the places are flood affected, and in the flood affected areas, it is very difficult to make the hospital, make the mother successfully breastfeed their child. But in those scenarios, we may promote the breastfeeding corners. If in the we can make some breastfeeding corners, not only in the camps but also in the areas where the public gathering are there, fast and present, etc. Children, mothers can successfully breastfeed with agitation. That should be promoted. Mostly we have in the guideline of the flood affected areas also, so that people can focus on can successfully breastfeed their infants in the disaster areas also. Thank you so much, sir. I really
Thank
I'm
you.
sorry,
Manish.
my network was not good.
Thank you,
I
Manish.
shared the slide.
We could hear the last part a little more clearly, but I wish we could. But the telephone numbers that you provided there, are they your number or is it for the office?
Oh, this is office number, BPNI office.
Thank you.
BPNI website, you can go to the website and you can contact. So
there is one question, Manishaji, that's come here, which is Assam, Jorhat, the Assam Agriculture University used to have a home science college, and I think it is now called, it has taken the name, it is no more called the Home Science College, it is called the
College of Community
Science. And thank you for mentioning this. So this was a question that came up saying, what happened to the Home Science College? And it is now, what has happened, if I may ask very quickly, what has happened to the home science colleges in other agriculture universities in India? Are they still?
So most of the home science colleges have been renamed because earlier in home science colleges only the girls or women were
admitted,
studied, but now co-ed has been started. Co-education has started long back. So even when I joined, my earlier batches have already included boys. So because they have included boys, and earlier the home science were confined with some special, mostly on the some of the closed areas. But after community science, we have started broadly with the communities and not many other works we have spoken. We have started. So when the home science have been named community science, the perspective and the aspects were broader in see. And
we are very lucky to have you here with us today, because in our platform we've been asking why can't we connect with agriculture universities, and we are delighted that you have joined us today. There are 63 odd agriculture universities in India, and it's the first time I hear about the community science colleges, that a transformation of the home science colleges. So we are delighted you are here with us. We would like very much for you to keep joining our future programs, Manishaji. This interaction is very, very important. And we feel delighted that Bishnu Prasadji has somehow managed to convince you people to join our platform. It is a journey where we can learn a lot from what you are doing. And in turn,
the next speaker is also from our college, sir.
Thank you. We look forward to listening to our next speaker. Please stay with us, Manishaji, because we want to see this interaction between Ayurveda and Ayurvedic knowledge, along with the agriculture universities, to be strengthened a little more.
Yes, sir. I'll try to be in the link, because somehow if my network get connected, please pardon me.
No, it's fine. We got the most important message there towards the end, that there is a wonderful accreditation program and where we can find that information. And you have given numbers, telephone numbers for people to contact. So that's very important. Here, Pavanji has presented our sessions starting tomorrow. Manishaji, this is also very important for yourself and colleagues in the agriculture universities. Most times, I don't think they understand fully what is Ayurveda and what are these Samhitas.
Yes.
And I think this dialogue, so we feel very lucky that yourself and your colleague have joined us today, and that Bishnu Prasadji has enabled this interaction. So thank you once again, Manishaji, and welcome all the colleagues from your university, the agriculture university.
So some of our colleagues are also working on a medicinal plant and all.
Yes.
Nutrition and Ayurveda is closely related, as I.
Of course, yes. I think this is what we can learn from this kind of interaction. So we Our wish is that Manisha ji and Pramila ji, that you will bring more colleagues from your agriculture university in specific areas like medicinal plants or like what we have today, and also the more general area of food and health and environment, food and health. Thank you.
Yes, sir. Thank you, sir.
Thank you, madam. Thank you very much. So as I was communicating, sir, tomorrow is great program again, 417th number, Charak Sanhita Principles for Practice. Daily topic will be changed, but Charak Sanhita will be in focus. Charak Shiromani Samman to Professor Banwari Lal Gaurji and Tapan Kumar Vedji. From Vishwa Ayurved Parishad, all senior legendaries will be with us. 3 speakers for first day of the 15th day. Dr. Brajesh Mishra ji, Dr. Bhupendra Mani Tripathi, and Vaidya Parul Joshi ji. They will be inaugurating the session as opening batsmen for the 15 days, and this celebration will be continued up to 15 days, sir, up to 15th August. And in the meantime, our webinars will be continued from 6 p.m. and this time, day after tomorrow, this time will be 8:30 p.m. to onwards. Thank you. Thank you, sir. This was
So,
the
Pavanji,
information.
there is a question here. Is the time
Yes.
correct on your poster?
Time.
इसमें 6 बजे लिखा हुआ।
नहीं, कल का तो ठीक है, सर।
कल का तो ठीक है जी।
कल का तो ठीक है, क्यों कल बहुत सारे स्पीकर हैं।
अच्छा जी।
लेकिन
अच्छा,
अगली बार से चरक संहिता पे केवल 2 स्पीकर रोज।
ठीक है जी।
वो भी 8:30 बजे से।
8:30
न्यू टैलेंट्स एंड कैलिबर्स, सर।
बहुत बढ़िया।
अपनी वेबिनार जो 6 बजे से होती है वो होती रहेगी।
चलो, सुभाष। Pavanji, before we invite Pramila ji, who is already here, Pramila ji, namaskar. I just want to highlight थोड़ा सा यहाँ पे सोफी जी है हमारे साथ यूनानी इंस्टीट्यूट से बेंगलुरु से. Sophie ji has put a very important paper here, Traditional Unani Perspective on Insufficient Milk, Galactogogues. Usme, you can see that overlap between Unani plants and Ayurvedic plants. Us paper ke andar, they have given a list of...
I welcome Sophie ji, sir, but I am requesting all legendaries 20 days before. So please bless us, bless this platform. As a speaker, Sophie sir.
सर डॉक्टर सोफी सर को जो परसों उनका जामिया हमदर्द में प्रोग्राम हुआ है उसके लिए सब लोग मिलके बधाई दीजिए. उनको सम्मानित भी किया गया इंटरनेशनल अवार्ड से, जहाँ प्रोफेसर सुनील जोशी को और किया गया है और प्रोफेसर मन्नू कुमार को किया गया है.
Sophie ji, congratulations from all of us here. शायद Sophie ji has...
Yes, sir.
Sophie ji, congratulations from all of us. Namaskar. Very happy to hear such wonderful news. Thank you.
The awards are initiated by Jhandu sir.
Dr.
Oration Award.
Yeah.
Sophie ji, congratulations once again. I think Pramila ji is here. Pramila ji, yes. You are appearing, your name is appearing as Renisha Kashyap.
My daughter. I'm using her laptop.
Okay, you're using her laptop. Could maybe Pavanji, with your permission,
yes.
With your permission, perhaps Pavanji can change your name so that our viewers...
She's
I was trying
professor again, and College of Community Medicine in Jorhat. Welcome, madam. Welcome.
Thank you so much. Thank you, sir. Thank you, sir.
Now stage is yours.
Okay, sir. So let me try with the slides. Is there any difficulties? Let me change this.
Definitely.
So it's coming, sir.
It'll take, it's just coming through. Let us see if... sometimes it takes a little while. There's a lag between when you display to when we see it. It is not yet on the screen. Ah, it's here. Thank you. Pramilaji,
Thank you
could
so
we
much,
have it in a
for-
presentation mode if it is possible? Thank you.
Yes, yes, yes. It is okay now, sir.
Not yet. Or perhaps we shouldn't spend too much time. If you have difficulty, please, we should proceed. If you are not able to change to presentation mode.
But I have changed it. But,
Yes,
it
there
will
is a
come
problem.
now.
Sometimes it doesn't. Oh, there it is. Thank you. It's there now. If you could go to your first slide, maybe your viewers can get your contact details also.
Shall I start, sir?
Yes, if you wanted to go to your first slide, that's right. Then people can see your contact details also. Thank you.
I'm on the first slide. Now it's the first
It's
slide.
the
is
first slide.
displayed.
Yes. Thank you. Thank you, Pramilaji. The floor is yours. Thank you very much. Thank you very much for joining us today.
Okay.
We can see your slides clearly and we can hear you clearly. Thank you.
Thank you so much for inviting me and having me here as a part of you. Sir, today's topic, infant and young child feeding practices. This is nothing, just today on in action with the World Breastfeeding Week, which is out the week. So I just pick up this topic just to again to have a discussion on this forum, so that we all again revive the feelings of this importance of feeding practices. Let's start with the word that is that would be the medicine, and this is one which we have 2,500 years ago we have this moment becomes more important and more powerful words. To do so, we have many foods which are having a part of our brand side. So let's know what type of foods, especially for the young child. And in my, I will be mostly covering the infant and child feeding practice, as well as some of the foods which are really important for this particular age group. So feeding start right from the start is very important, and it is possible, best possible, and rather can start to life. And every child, each and every child has a right to good nutrition according to the convention rights of the child. So nowadays, what we have seen, like our children, sometimes we feel like they are mostly confined with the processed food, mostly. Almost 25% of the entire food of a day or maybe a week is mostly processed food, and mostly the process which is completely in the whole gut microbiome. So it is right time to understand what exactly the biggest food are, and we will be going ahead to the genius of our behavior to select the right source of food. So throughout the process of our life, we need right food, right amount, and the right time. So let's see. Somewhere in this process of our life, somewhere we always see some of the malnutrition are a silent emergency. So we hardly give some of the malnutrition. Whenever we say malnutrition, we have a notion of towards the undernutrition. And this is one part where we hardly go for, because most of the time, slightly or mildly malnutritions are completely like not showing any sign and symptom. At the same time, this has got a tremendous impact on the growth of the child. So undernutrition is associated with 45% of the child's death. this is something which is very dreadful. We hardly give importance to this undernutrition part. And undernutrition until unless I'll become severely malnourished. Up to that moment, we have no idea how the child sign and symptom through their actions or through their behavior. We never try to read. So that way, undernutrition is completely recognized as well as unidentified. So, but at the same time, this dreadful undernutrition is to 75% of the child's life. Globally, in 2020, 149 million children, especially under 5, were estimated to be stunted. So stunted most of the time towards to this part of region, that northeastern region, most of our population, they're comparatively sorted in the northern part of India. But within that same population also, this stunted is sometimes unrecognized. So it was reported that in 2020, 149 million children under 5, mostly under 5, were estimated to be stunted. That is too short for the age. For a particular age of the child, we have a standard that how much of height should be for that particular age group. So that way we identified, and it was reported that this much of children's there are stunted, while 45 million were estimated to be wasted. At the same time, the teen or maybe the weight of the child is comparatively when we compare with the standard, we have different standard. We apply different standard to compare the child for their nutrition status. So in that case, this much of 49 million children, they are estimated as the wasted, and at the same time 38.9 million were overweight. So this particular scenario gives a dreadful situation for us, unknowingly. So we have to reach with this unreached part of population through different approaches. We have different approaches. One of the most important approaches is the dietary approach. So promoting early child development is very crucial, and especially when we say children of 0 to 3 years. So this is whatever definition we have seen, the much of figures we have, this has to be made up somehow. So this, being we in the nutrition part, as nutritionists and the dietitians, we have tremendous role to bring up this gift to a smaller, in a narrower ways. So this, in this report card, it was shown that estimated amount of about 36 million under 3 children were underweight, and thus they develop underdeveloped. So this will lead to a citizen which is not productive. So leading the nation again imperfect or not growth. So at the same time, by having as especially from the under 3 children, having overweight or underweight, this will again can have different impact on the child health, like the impaired cognition, physical, psychological development, sometimes impact. That it also impairs the intellectual strength, energy, and productivity. These are the 3 important things where we have to give more emphasis of developing or making this particular children under the 3 years especially. And nowadays ICDs come up with 5 or 6 years old children. So this way we have to work on this particular age group, thus making the nation more powerful and strengthened. As a strategy globally, especially for the infant and the young child feeding practices, this particular guidelines came in the year of 2004, August 6, and during those period, it was mostly focused on the under 3 malnutrition. But nowadays it is like it's been changed from 2010, and even the ICDS programs, they also include children for up to 6 years, and as well as the adolescent girls, pregnant and lactating women. So there are nationally, these particular programs are pumped up so that we can reach this particular section of people. So as Manisha has already approved 5, which is the latest one, so I don't think I need to discuss this more. So another important thing, I just wanted to say that we have different strategies for promotion of this IRES. So first one is the mother's actual affection, which Manisha also discussed. And the second one is nutrition rehabilitation center. And third one is facilitating in any IMC egg, which already discussed. And we also have this strategies of taking some village health and the nutrition day celebration in the village level. So these are the components mostly for promotion of this IRES. So let's coming to the first part. This is a mother's absolute attention. This is a Ma, which Manisha also talked about, and 41.6% of babies, they have early initiation of breastfeeding. At 78.9. That means what we are the government in the health sector, government has already, hello?
Manish,
Hello?
we can hear you.
Yes.
Thank you.
Okay. So this way, like initiation of this breastfeeding, government also trying to promote this in different ways. So even still then, children delivery rate at hospitals, it was showing 78.9, almost near about 80% of the delivery take place. And out of that, 41.6 babies, they are reported as having early initiation, whereas the remaining were still keeping beyond like 1 hour or 2 hours, sometimes maybe one day after the delivery. So there are different like reports generated, and this facility based on IRES under MAP. So this the particular program, it mostly most focus on the early initiation of breastfeeding. Then some of the components we can easily we can see that health facility tracking is one important component of this particular program, where lactation management centers are open up, and they also try to build up the capacity of the health providers, especially the nurses, and they also try to focus on most of the mass events, breastfeeding and child feeding practices. Then community level activities also they do, like the mothers meeting by the ASA. There's the 10 workers which are link of the ministerial level as well as the rural level. And then even trainings of the ANMs or this particular health sector. So in different sub-centers, and they also provide some facility awards, where that particular some facility are encouraged by providing some awards also. So another one is IMS, where mostly this our Manisha already talked about this, and in this particular aid, the infant milk substitute, even the feeding bottles and even the foods which are generally available in the market, like the Cerelac and all. So they should undergo the regulation of production, their supply, and even distribution will come under this act. And this was on 2003, and it is believed to be the central law, and we all in all the states they have to oblige this particular law. So, and under there is something like prevention falls and a severe wastage sets in. then what to do. So that way we have different operational guidelines are there under NRSM, and they also provide different foods and different shelter to this particular severely acute malnourished children. So they increases significantly the risk of morbidity and mortality in children under 5, especially this severe malnutrition, and leading to what that lead to the growth retardation and impaired psychological and cognitive development. And they also they also provide some centers where children are kept for observation, and in 1,150 NRCs are always established across the country, and where all the dietitians are working hardly to bring up the children which are severely malnourished into a normal condition. And there is a complete monitoring and a follow-up of the children, and especially the caretakers or the mothers or anyone who is looking after the baby. Then during the stay at this particular nutrition rehabilitation center, and the children will be taken care for 24 hours. And the children they monitor, and along with that they also get the medical treatments. And therapeutic feedings are there. So different feedings are starting from the lowest concentration to the higher concentration, and there is continuous prioritized formulations of the children provided to the severely malnourished children from the day 1 to the day where the child is at normal. So once the child bringing up to the normal weight, or then only the child is allowed to leave the center. So that way therapeutic feedings and different formulations they used to provide to the child. And the sensory stimulation and the emotional care, especially children, they used to see along with the other sign and symptom and another medical conditions. The medical team of under this NRC, they also see the sensory stimulation and the emotional care. Counseling on everything and care and hygiene also provided to the child, given to the caretaker, so that the whatever feeding pattern, the amount or whatever sanitization process that continue in that particular center, that has to be replicated at home. So that way, any guardians or mothers especially are again given training in this center, so that they can continue that same way of feeding the child. Demonstration and practice on the preparation of the energy-dense child foods usually available, especially locally available, and it is one mandatory for all the science that they should have a nutrition garden of their own, maybe next to the center. So that way, whatever food available at that particular hospital garden, they have to cook it and prepare themselves. And that way, demonstration of how to prepare foods of the children are also given to the caregiver and especially the mothers. Then some of the components, say we have this under this infant and child health, child feeding practices. This is mostly of three parts. That we mostly focus on the initial breastfeeding, then exclusive breastfeeding, and complementary feeding. So initial breastfeeding, each one of the components, they have their own role and own potential for bringing up the child in the right way. So early initiation of the breastfeeding, immediately after birth, preferably 1 hour, within 1 month, 1 hour especially. So we all know that whatever milk secreted just after the delivery within 1 hour or half an hour to 1 hour, that generally we used to call colostrum, has got different biological and different potential roles, which can really have some impact on the child growth in a better way. So this initiation is very important, and really government has taken up an exclusive team for starting giving the mother to give this milk within 1 hour from the time of birth. So sometimes, for especially we have seen that mothers who are giving first baby, they have no idea, and moreover, they are like a bit side-eyed. At that point of time, nurses and especially the mother or the grandmothers, they come forward to help the lady to start is feeding to the baby. And most of the time, 80% of the nowadays delivery is mostly of the cesareans, but lots of pain the mother feels. The mother sometimes have some conscious mind, but still then the whole team, they support the being mother to feed the baby within 1 hour, so that whatever good amount of colostrum can be given to the child. And exclusive for breastfeeding, we all know these days, like especially government also given us this opportunity to take 6 months leave to look after the baby and feeding the baby without any break. So this particular component is also one important component of this feeding practice. Then coming to the third part, that is the complementary feeding, and this is nothing but timely introduction of the complementary food, and mostly complementary food maintaining this adequate diet and dietary diversity beyond the 6 months. So along with the breastfeeding. Breastfeeding within our reduces the risks of neonatal mortality by 33. So different studies throughout the country, across the country, in different hospitals, especially the hospitals, studies were, and they come up with this figure that 33% of the children, they have seen there is less like mortality. Date of the child reduced up to 3%. Inclusive breastfeeding can also reduce 13% under 5. Breastfeeding has tremendous impact on the cognitive development, gain of up to 10 IQ points. So complementary feeding, whatever we give after the 6 months, it can also promote optimum growth, prevent stunting, micronutrient deficiency, anemia, and overweight. Then after this, coming to the most important part is the breastfeeding, how we can see how successfully we can feed the baby. So it is said to be that there should not be any prelactal feeds because it replaces the colostrum. So this traditional method of feeding the baby with honey or something which is we believe to be like precious, or once the baby is born and all the family members, they feel happy, excited, and we have a tradition giving some sweet to the baby and in the form of honey or something, some milk mix, and sometimes with other sweet things. So that particular, this type of practices nowadays, it is completely banned, and none of the child is allowed to feed anything, not even water. So there is no prelactal feed except mother's milk. So this will help to replace the colostrum. One half hour after delivery, there is no use. So that giving some things as a prelactal feed will sometimes replace colostrum. And it also in the prelactal feed, if anything is given, that also reduce baby's desire for the breastfeeding. So once the baby comes out to the normal world where the baby will be feeling sensitive, and also baby have some taste besides this milk, baby may show some reluctance or maybe some rejection to breastfeeding. That is why we never give this prelactal feeds. And it also increases the risk of infections. So most of the time, baby suffering during the first part of first year of lifetime is they were very prominent in the last 10 decades. But nowadays, soon after the exclusive breastfeeding program started, and prominently it is prominency in the society, then onwards, infection rate among the children decreases. Then even the risks of intolerance or allergy may happen. So these things again, I will obviously discuss in the later part of that. So successfully breastfeeding means there is no bottle or no artificial teats. The teats which is simple, similar to mother's nipple. So these things should not be given, and this will sometimes it will lead to some confusion of the nipple teats and nipple. So demand feeding as this successful feeding. So breastfeed on demand. So 8 to 10 times feedings, if possible, can be given to the child and in a 24 hour. And breastfeeding mostly whenever the child, like especially even at night, if the child sick, then we have to give. And if the child is still sleeping, then also we should provide milk to the child. We should breastfeed the child. So there should not be any restriction on length of breastfeed. Most of the time we believe to have it 20 minutes to both the sides. But if the child, sometimes it depends on the child growth also. So if the child seeks more of time, then we should continue. There should not be any restriction on frequency of breastfeeds. So whenever the child shows any sign, or maybe without showing any sign also, if you give the child and if the child accepts it, then we should continue. Some of the hurdles maybe the lack of family support. Sometimes the mothers engage in some other household chores, or maybe some job, or maybe some other activities. So in that case, lack of the family supports, the family cannot give breastfeed to the child. And sometimes lack of support by the health professional. I have seen this one. One of my friends, she because of not getting proper nipple, she cannot feed the baby. Though she was producing lots of milk. So that way, if the health professional, if they not supporting the mother at the right time, at the initial part of breastfeeding, then sometimes it also leads to not unsuccessful breastfeeding. Then commercially, there is some influence also. Then sometimes feeling of not enough milk among the women. We also feel the amount of milk is whatever producing may not be enough for the child. And especially this type of feelings happens to the mother who gives a birth of twins baby. So feeling of not enough milk is not true actually. This is just a perception. So reinforce mother so that the self-confidence is must, and to help this we have to ensure frequently suckling, and we have to effective suckling. So there are different poses, different timings of the baby. So diet the baby, how the baby is sucking the mother's milk, or how effectively the sucking is done. And that way, mother has to be encouraged, mother has to be motivated and reinforced, so that this type of feelings should not be there. So mother's confidence throughout the prenatal, starting from the prenatal before the birth, and antenatal just before the delivery, and the postnatal. So throughout the complete pregnancy period as well as the lactating period, the mother's confidence about herself to be a mother who can provide adequate amount of milk as well perfectly okay milk to the child should be developed. We all know that we have different benefit of feeding breast milk to the child, and thus reduces the bleeding and anemia, and it also helps to delay the next pregnancy, and it is always protective against breast and dementia, which is one of the most dreadful disease among the women, especially in the developed countries or as well as developed states where mothers are more concerned about figures, more concerned about time, or maybe sometimes not getting time, sometimes lead to the breast cancer. So this is mostly like the mother doesn't want to feed the baby because of figure concern, or maybe not getting time, that can also lead to breast cancer. And it also sometimes feeding the baby also helps to set some weight also, and most importantly, the emotional bonding between the mother and child. This bonding is only one God-gifted bonding, that strong bonding, unbiased and unconditional bonding between the mother and the child. And we all know that mother's milk needs the nutrition. So it at the right way, the right composition in terms of nutrients. Maybe it may be in the macro or protein, fat, or maybe in immunity nutrients responsibles. All are in the mother's milk. So that is why up to 6 months we can eat without any preparative food to the child. The child can go up to 6 without the input, but just on the mother's milk. So mother's milk is really nectar and life-saving for the mother as well as the mother. So obviously we all know that it is completely a complete food for baby up to 6 months. Not to 6 months, up to the moment the child is feeding, but at the later part of life, the amount of nutrients the requirement to development of the growth of the child depends. So the in demand become more nutrients, where the mother is supplying 1/2 or the 1/3 of the requirement. So that way we always start after the 6 months of completion, we come up with a complementary feeding. So those are coming the later part. Then secondly, we can see it's really a perfect nutrition, where all the requirement in that particular proportion or the amount, it's there in the mother's milk. Only the thing is the right way of giving the feeding, the sucking style, the timing, the frequency, all again differs. But otherwise, if the child is fed perfectly with the mother's milk, so it is obviously leading to a healthy person in the later part. And the one most important belief is that it contains high amount of nutrients which will be giving to towards the development of the most important, obviously. So in case of mother, it was already mentioned, and it also helps to prevent infection, because all those immunity boosting nutrients were there, so that into more of immunity. It also prevents the diseases and making the milk is it is believed as the most easily digestible for baby at the right constituent. So these are all the benefits provided by the milk to the baby. So we all have benefit to the society, because reduced absenteeism of mothers as breastfed children are less prone to disease. And there is always economic gain, because obviously feeding the baby for 6 months without any break will develop a child, completely will produce a perfect person, mentally, physically, as well free from all disease. So obviously there will be more of productivity, working capacity, and capability of thinking. Everything will be gained, so that economically gain of the nation will be there. Then it will enhance bonding between the mother and this obviously, this relationship will obviously in the society, it will help for a better society. So when it comes food blends with mother's milk, obviously, as I've said, once a child reaches he is 6 months, then obviously the rate of growing of the child is comparatively much higher than the amount of milk, breast milk. So in that moment, we start of thinking of complementary. Let's see whatever complementary feeding we are having here in the India as well in the northern part. So complementary feeding, mostly we have 5 components. For this is very important. We always have to have this idea of quantity, frequency, diversity, and consistency. So whenever, like nowadays, people are women's, which are mostly the first baby women's are very concerned about the complementary feeding. I was in the hospital for 5 years as a dietitian in Joya Medical College and Hospital, where most of my clients were from diabetes as well from the this particular firstborn baby mother. So about the food, what type of foods we fed to the baby for the first time, and that we have a tradition. So, but still, then they always come up with the always come up with the curiosity what type of food is completely perfect for the child. So in that particular moment, we always have to have just 5 components. First one is the quantity, how much to give to the child, appropriate to the age of the child. Then whenever after that, we will set the quality. So if this much food is given, then what should be the quality? So which will be more heavier at that point of time. Frequency, how frequently the child should be fed. Whether we should feed 5 times or 2 big meals or 3 big meals according to the age or according to the demand. That way, the frequency have to settle down. Then again comes the diversity. So diversity, when diversity comes, it is one of the most important part. Most of us, we always stick up to one food group or 2 food groups only for the babies. But we have to have all the food groups, especially the 5 food groups, so that the child get all the nutrients from all the food groups along with the breast milk. And most importantly, as the child is not having any teeth and not able to eat by himself, the consistency should be at the right consistency. So calorie dense as well, it should be easy to swallow. Timing of food. Let's see what is the right time for giving this complementary food to the child. To minimize interference with normal pattern of breastfeeding, complementary foods should preferably be given between the breastfeeds. So whenever we have a continuous breastfeeding, we have to provide the complementary feeds. So along with the introduction of the complementary feed, breastfeeding should remain an important component of the child continue in the second year of life. Then when we come to the complementary feeding, let's always the first food should be always with the fruits. So we have a ritual here as Annaprakan. So where the baby is given for the first time, which we complementary feeding. So this introducing of the first food to the child, especially or especially for the ritual one, but generally whenever we start with the for the first time to the baby, always we should start with fruits, because the food has this fructose form, which is easier for digestion. So like apple and all, we can have apple, stew apple, and we can start with the food for the first time. Then one more important thing is that whenever we introduce any food, that food should be continued for 3 days. Because whenever we introduce the food, we have to keenly see that whether that particular food develop any allergy to the child, or whether the child is liking the food, or may not be sometimes some of the sweet or some food. So For identification purpose, whatever food we introduce, that should be introduced for 3 days continuous or at least 3 times feeding, so that we can completely settle down the particular food of the likings or the disliking of the child. And one more thing is that whenever we give the food particular for 3 times or 3 days, then the child will develop a memory of that particular food. Whenever the child see that particular bowl, then the child can imagine that what will be the taste of that particular food. So that way, for any food introduced to the child should be at least tried for 3 times. Then use of single food prepared for baby foods rather than the combined meals first. And this is for the initial stage. While we talk about diversified food as well, we also use this data, use of single prepared food and baby foods rather than the combined food. So we will start with the single food. Suppose we will start with a rice gruel, or maybe some with semolina, porridge, and also single foods we have to start with, and later on in the later part, say around either 9 months or the 10 months onwards, they have to provide with the combined meals. So this is one food we have to start by giving 2 to 3 tablespoons of soft semi-solid food and in the frequency of 3 meals or 2 snacks per day. Adding foods too soon sometimes may lead to take the place of the breast milk. So we have to see that we should not add so much of food abruptly. So at least 1 month or 2 foods or 3 foods in a month, and then later on in the next month again 2 foods. That way we have to increase the amount of food, types of food especially, and it sometimes adding too much also lead to the low nutrient diet. So one particular food if we give, so particularly at one time if one food is given, then the amount of nutrient that will be getting in a high amount. Then increasing risks of illness. So this is also one important thing. So if we add one food and we can see the reaction of the child towards the food in terms of physiologically and psychologically. So in that case, like if any food is showing any allergy or any like disturbing to the child physiology, digestion, and anything which is not preferable, then we can stop the food at that point. So that way we have to see one food completely, then we can start the other one. The increased mother's risks of pregnancy sometimes. So this also leads sometimes to many food at some time, and that also leading that mother's risks for the pregnancy also. So and adding to it, sometimes some of the foods we think these foods are very like some of the foods we think children don't like, so that way we keep aside some of the food. So this will lead that the child doesn't receive nutrient needed, and the growth and development slows down, and it sometimes stops also. So risks of deficiency and malnutrition because of that, like depending on the only depending on the food which is repeatedly given, that will obviously lead to the deficiency of any nutrients. Like only one food will be providing few of the nutrients while the nutrients are not getting. So that way the prolonged feeding of same type of food sometimes also lead to lack of deficiency, leading to malnutrition and increase, and obviously this will increase risks of ill health. Quality, whenever we say adequacy in terms of nutrients, and these nutrients obviously it will come from the different groups. Then some of the staple foods we have to see, there's mostly the cereal staples, right? Like the rice, wheat, maize, and millet, and even the legumes should come along with the cereals. And fats, some amount of fats are to be added to the child, because fats are believed to be a good supplier of energy. Because 1 gram, whenever we have, it will obviously provide us 9 kilocalorie, and sugars to provide energy as well as taste. So for taste purpose, as well as to give to make the food more nutritious, to provide some amount of sugar also. Then sometimes introduction of this animal origin foods like your milk, curd, egg, meat, fish, this will also give good quality protein as well vitamin A and calcium. But here I would like to say that egg and fish and the cow's milk, these things we need to give up 1 year, because all the organisms that come along with the milk, or maybe the egg or the fish, sometimes give allergy to this child. Then vegetables and fruits is main core of nutrients for the micronutrients as well as the vitamins. So provide micronutrients like iron and vitamins and supplements. Sometimes we also give iron supplements that may be required, because up to 1 year it is believed that the amount of iron supplied or the transfer from the mother is quite sufficient for the baby. But at the end part, we have to start and first year, which is starting of second year, we have to obviously make sure that we provide some amount of vegetables. So these are the few food groups we always without fail included to the child's diet. One way or another, we have to craft the food sometimes, or maybe the singly we have to start the food, and most soft egg after the child completes 1 year. So other vegetables are locally available. Vegetables and fruits, they will be into diet. So these are the enriched staples. The animal foods, these are zinc, vitamin A, iron, calcium rich foods. And the legumes are most, we believe that it contains high amount of protein. And vitamin C, it will to what amount we are having iron in our diet, that can be easily absorbed by the presence of this vitamin C from different food sources. And this is different food sources we are having. Then varieties of food varieties of food to be included. So this is from 9 to 12 years, half cup 4 times and 2 snacks meals between the meals should be introduced to the child. And here it is said that once the child is 12 months, mostly there should be introduction of non-vegetarian foods. Then complementary foods, consistency, it's to be soft, it's to be digest, and mostly it is expensively we have to prepare, and the locally available more fruits and vegetables to be introduced, because whenever we say locally available, our food microbiota, the ecosystem of our physiological system is comparatively compatible. So whatever available in particular region should be provided to the child, so that the child can enjoy its food as well. The digestibility will increase. At the same time, the child will continue for his lifetime. And it just mostly is very easy to prepare at home also. And the things, but it should be always nutrient dense, and the consistency should not be initially, it should not be too thick or too. And what we have to salt as well as sweet. We sometimes develop more interest in salt or sweet, so that way we have to give the opportunity to identify the trait towards the taste, and finally ensure introduction of all the possible food stuff. But at this time of at this 1 year of the baby, we should not give excessive frying, and obviously anything which is hard should be produced especially at the forenoon of the day. So water and liquid fluid should be given, but there should not be added sugar. So these are the few foods offered, and maybe mostly according to the structure, we always give for go for soft porridge, well mashed vegetable, that foods, that frequency 2 times per day, and at 7 to 8 we can, and at least 3 times per day, plus we have to give some breastfeeding as well. And then for 9 to 11 years of child, 11 months of the child, we can start some with solid food, which can, with the child at this point of time, the child starts teaching. So to enjoy teaching or to give some sense to the baby, we can give some chof and mess food that the child can easily pick up. Then 12 to 24 months baby, the food, family food, especially prepare at home, should be given to the child as 3 meals, and sometimes in between the meals we can provide 2 snacks. So here in this slide, I just wanted to share you that we developed one this Assam mix, and this particular food is nowadays, it is given to all the ICDS centers, because we developed the technology and this technology is transferred to a particular manufacturer, and they have started selling it to different stores and especially pharmacies, and the government has taken up this as a mix, as a supplement or complementary feeding supplied to all the ICDS centers of Assam and some other 3 states of India also. And this is mostly prepared from 4 food items, and we have taken rice, we have taken the sesame seed, we have taken some germinated green grams, and some amount of groundnut. So that way we took this 4 ingredients and we prepared in the department following this particular method I'm given here. So this way we can prepare, and it's easy to prepare. And at the same time, the particular ingredients are easily available around us. And when the mother, if the particular this particular ingredients are processed in the required powder, then they can be at home. Yes.
Slide fast. Actually, time is over. Slide fast.
As I said, honey and egg and cows, they have different anti-allergens. Allergens actually. So start before 1 of the child. So that is thus my slides finished. So it is saying that there is no higher calling in life than protecting children from harm. So we believe to protect our children with types of food at the right amount, right time. Finish my
Thank you, Pramilaji. Thank you for a very detailed presentation on many aspects of the early nutritional needs for children. What we are learning, very importantly, are the big programs that are going on between the agriculture universities and the Ministry of Health and Family Welfare. And we would also hope that these interactions will extend to the Ministry of AYUSH also. So I think Pavanji will take us. Thank you for joining us again today in the elaborate discussion and for sharing your contact details in your first slide. We look forward to Pavanji taking us to our last presenter today. Thank you, Pavanji.
Thank you, sir. Thank you very much. Before calling our respected Dr. Parul Joshi ji, Vaidya Parul Joshi ji, I would like to request both the speakers from Agriculture University, please support us by recommending a speaker for biofuel If you have any speaker for biofuel, please recommend us, because on 10th August, World Biofuel Day is there. So if any expert is there, please recommend us from Agriculture University, expert on biofuel. So I would like to welcome now Vaidya Parulji Joshi from Sri Vala Hanuman Ayurvedic College. Welcome, madam. Welcome.
Thank you very much, sir.
Hari Om, Hari Om. Swagatam, Swagatam.
Is the slide visible, sir?
Parulji,
Yes.
we can see your slide clearly. Agar iski wo, if it can come to presentation mode, then we will enjoy it even more.
I know it. Okay. Is it okay, sir?
Ji, thank you so much, Parulji. Bahut dhanyawad. Very good.
Good evening,
Good.
everybody. Today there was a problem there. My slide, which I had already prepared, got corrupt. So this is the presentation which I have prepared while listening to the other speakers. All the speakers presented very nicely, so leaves very much less for me to present. But I would like to share some points which I felt like sharing on the stage. There are a vast group of galactogogues in Ayurveda. We have Stanya Vruddhikara, Stanya Shuddhikara, Stanya Srutikara. Means at least 30 herbs which can act as galactogogues. We have a series of, as Madam Kashyap said, we have a series of food items, food grains, which we can use routinely as galactogogues. But what is a galactogogue? A galactogogue, spelling is different, is a Greek word meaning milk lading, also known as a lactation inducer or milk booster. That's all they can talk of. It only promotes lactation in humans or other mammals. Not only animals, they are only mammals. It can be synthetic, it can be plant-derived, or can be endogenous. They may be used to induce lactation and to treat low milk supply. When there is less lactation, mother is not able to feed the baby properly, then we need to use this. This is all according to what is on the net. They say fenugreek. We call it methi in local language. One of the most well-known galactogogues is an Indian spice. There are other things like ginger and all my former speakers have talked about. They also improve milk production. But they just don't improve milk production, they improve the quality of lactation. There are certain herbs which have adverse effects which are not to be taken while lactating, and that thing needs to be taken note for advising a lactating mother or a mother who is due for labor, who is going to beget. It says on slide share, it says there is no ideal galactogogue. They have named certain chemicals. They can be used for 7 days, but garlic, ginger, coconut, jaggery, ghee, khaskhas, bajra, pepper, etc. are also galactogogues. But they have said the thing which all my previous speakers have said: self-confidence, freedom from anxiety, soothing environment with vigorously sucking by an active baby are the most effective prerequisites for successful establishment of lactation. This is the sum of what we can find on the net. Foods that increase breast milk, natural galactogogues. We find so many slides talking on these things. There are certain foods which have to be used in a nursing mother. But as we have seen earlier that there are certain foods named as galactogogues are really harmful. For example, in Varshakal, the present time, we are giving green leafy vegetables to the mother to stimulate her lactation. That will lead her baby to diarrhea. So, though it is a galactogogue, it is not advisable during Varshakal. Same way, a mother suffering from indigestion is given protein-rich diet. For example, groundnut. That will lead to indigestion in the baby. The baby may start vomiting and have diarrhea and have fever, and then there will be too much chaos in the baby's health. So, proper instruction for what should be given when is very much needed. I, being from Gujarat, have to take care of people following Jain Dharma religion, following Swaminarayan religion, following Vaishnava religion. They avoid all types of non-vegetarians, even eggs or egg items or everything. So I have tried to avoid those things which are not eaten by these communities. And it's my experience that non-veg is not always required. This slide is very, very informative. Ways to rebuild or increase your breast milk supply. But breastfeed more, use a nursing supplementer device, ask your doctor about prescription, or use a breast pump. All the four supplies or maneuvers will ultimately lead the mother to troubles. For example, a mother is breastfeeding the baby more. For example, every 2 hours she was feeding, now she's feeding every hour. For an example, I'm telling. So what happens is she remains engaged, feeding, and she cannot take care of her own self. And a baby does not need so many frequent feeds. Baby may require about 4 hours, depends on the appetite of the baby, but it's always demand and supply rule. Whenever the baby demands, the supply is always there. That is nature's rule. Nursing supplementer device leads the mother to many complications. So I have never, in my career of 45 years, I have never used a nursing supplement device. Breast pump also causes injuries to the mother and may infect the baby because how much ever we wash it is going to get infected. Prescriptions, they are not always needed. What is needed is proper care of the mother and proper food at right time and proper understanding of the food which has to be given to the mother. So, does the care of the lactating mother start after she delivers a baby? No, Ayurveda doesn't say that. Ayurveda says that from the time the couple thinks of having a baby, the mother has to take extra care of herself because she is going to give birth to a total human being. From one cell, she has to make a baby of having multiple cells and multiple systems, a perfect human, which is supposed to grow timely and properly. So for a healthy baby, the mother needs to be healthy. And for that, she has to take care of herself before conception. To be frank, before she even marries. The slide says 10 natural ways to increase breast milk supply. The thing that is shown in the slide is latching. So, is latch comfortable and pain-free? No, not so. It is painful because the baby sucks on the mother's breast, and that sucking creates a stress there, a tension there. And in the initial days, the mother will feel or will get erosion over there. So proper care of her breast, especially nipple and black, that is areola part, has to be taken continuously till she is breastfeeding the baby. If she doesn't take it, latch will not be possible because that pain will ask her to stay away from the baby. Baby's chest and stomach rest against maternal body so that baby's head is straight, not turned to side. Baby's chin touches maternal breast. Then and then the latch will be complete. Baby's mouth opens wide around maternal breast, not just that nipple. Baby's lips are turned out. From this, we can say that the latch is proper. So this is a diagram which shows how a correct latch is there. Mouth covers the areola, the black part of the breast. Lips are flanked out. And if that is not there, then as in the second figure, incorrect latch leads to insufficient lactation, and that is because of insufficient stimulation from the baby to the mother. As my previous speaker said, that it's like Shukravat Sampravartate, like Shukra, it just gets out from the mother's body. Without that, mother will not get stimulation, she will not be able to breastfeed her baby. So how to latch a baby is shown in this figure. Does the breast size, big breasts, do they really matter? Do they really give more milk? That is what is discussed on the website. There are so many foods given, exercises shown. According to Ayurveda, a Sutika is not supposed to go for any exercise. She is Jirna Vastra, Jirna Garavat. She cannot go for any exercises like the one she is sweating here. She cannot go for sweating that's going to injure her. Abhyanga Svedan in Sutika Paricharya are something different. This is exercise-induced perspiration, which is contraindicated for a lactating mother. Second point is, do large size breast matter? As in the figure, we see the large breast, lambastani, karalam kuryat, changes the whole face of the baby. The baby's face does not look good. Lambastani, mukhamachadayat, that is also not proper. Big breasts disturb the child cannot suck properly. And big breasts happen only when the mother is obese, she is having extra fat. So if all these things are taken, even then her breast may not become so big, and big breasts do not help. Although breasts will grow larger before and during breastfeeding journey, in the third trimester of pregnancy, the breasts grow, and if the breasts don't grow, then we ask the patient or the pregnant mother to go for a sonography, specifically fetal movements, because if the baby is having some problem, then and then her breast will stop developing. So that is a very important point. Breast size is irrelevant when it comes to how much milk is produced. Mother's feelings count. So even in small breasts, if the mother is Vatsalam, Vatsalyapurna, then and then she will give enough milk to her baby. These are different milks promoted that increase the breast size so that milk production, that is lactation, is increased. It's not so. These things along with milk may help the mother's nutritional status, and that way they may help increasing her lactation. But their increasing the breast size is not so scientific as far as the lactation of the mother is concerned. These are two research papers which I felt that I should put on this platform. And milk output from left and right breasts, whether the right breast gives more milk or left breast gives more milk, is what they have tried to discuss here. And I would like to quote Acharya Charak saying that if the child is a boy, the first milk comes from the right breast and he is to be fed on the right side first. That is Ida and Pingala Siddhant. If the child is a female, the left breast starts lactating first. And so she is supposed to be put on the left breast by the father in front of all the family members. And they are supposed to celebrate the breastfeeding of the baby. And this is supposed to happen on the first day, the day the baby is born. So there are so many myths and so many misunderstandings that are on the web. Assessment of the influence of mother's occupation and education on breastfeeding and weaning practice. The mother may be a gynec, the mother may be a pediatrician, but she does not have a practical experience. She may not be able to take care of her own baby. So what counts is, as was discussed in previous speakers, that in the case of home science, they used to teach everything. And so I always tell my relatives and friends that if you have a baby girl, ask her to go for 2 courses. If she's not so good in studies, ask her to go for home science. And if she's better in studies, ask her to go to be a Ayurveda Acharya. Then and then she's able to take care of the family. Let down. What is a let down? And how does it look like? Since I don't believe in this, I will not be speaking much on it. Home remedies to increase breast milk. And we can see that all these contain what are called food items. Taking care of the breast, seeds, and cereals. These 2 slides talk that fenugreek seeds, oatmeal, or those ladies who don't know what is oat, have never eaten oat, should not be given oat, because taking oat is not in their Panchabhautik Sangathan, and their baby will not be able to accept oat. I had an IAS officer as my patient. She was quite understanding. She had too much attachment towards Ayurveda, and she used to eat oats. Someone told her that if you eat oat, it's going to keep you healthy. So she took for 5 days and then she rang me. How is it, Parul, when I'm having so much gas trouble and so much indigestion? I said, what have you added in your this? I'm taking oatmeal. So I said, it's not beneficiating you. So should I stop it? I said, yes, stop it. Then what should I take? I asked her to go for kheer, payasam. And after she started taking it with putting saffron and elaichi, she said, I'm feeling better. I'm feeling energetic, because that is the food she's used to. So even Shatavari cannot help a person who does not have feelings for that baby she is supposed to feed. There are certain points here: nurse frequently, pump more often, and all that. These 3 photographs, all the 3 are labor women. They never talk about galactogogues. They never need galactogogues. They deliver baby naturally. The baby grows up naturally. But according to an NGO I worked over here with, Chetana, they said that the babies are born very healthy because the mother takes care. But after 6 months, the babies just start getting malnourished, and a 1-year baby will not be able to walk. So they did a survey in Rajasthan, Gujarat, and Madhya Pradesh. And that survey said that after 6 months, the mother is not able to feed the baby, and the weaning becomes sudden. The baby starts getting malnourished. And so if we take care of the baby from the 3rd month of extrauterine life, then the babies remain steady and healthy, and they don't suffer from any nutritional problems. The 4th photograph I'm put over here is about the mother. She's supposed to take care of her baby, and there we have put so much thing about her that she's not able to take any decision what she is supposed to do with this baby. So it's better someone from the family, like the photograph number 2. The adult in the family is helping the mother and child having a close relationship. That intimacy, that bonding between mother and child is going to support lactation. And as we see in the picture number 3, the father taking care of the baby gives confidence to the mother that my child is safe in this house, my child is being accepted in this house, and that you can see on her face also that intimacy, that my husband takes care of my child, is going to help her, definitely going to help her in lactating healthily and normally. These are certain home remedies. Lasun Kheer Pak. So wonderful, gives a result. And in our Saurashtra, they give lasun chutney. They make it and they start giving it from the 3rd trimester itself. Since they are used to lasun chutney, they will be able to take garlic. But those who are not used to garlic will not be able to accept it, and that will create many problems. Coconut water, lemonade, buttermilk help only those who are used to it. But here we can see that that is still good and it is grounded good. So those modak definitely help the mother in maintaining her lactation and quality of her lactation. These are all galactogogues. They are just put everywhere. Even in malls, you can find a galactogogue there. And the result is the mother, instead of taking care of the baby, thinks that I want to give my child something better. So instead of my pure milk, I'm going to add all this and feed the baby. That's not needed. Animals are given galactogogues. I had a friend in the veterinary department. He did his PhD from Bangalore, and his thesis drug was Shatavari. He did it on cows and buffaloes, and he tried to show that we can give Shatavari whole crushed, and that improves the lactation, quality of the lactation, quantity of the lactation of the cows and buffaloes. It was a wonderful study, and I'm sorry to say that at that time, there was no research done on Shatavari as a galactogogue in Ayurveda. All over India, I went through all the research papers and theses and all that. There was no thesis available at that time. I'm talking about 32 years before thing. So now it's a proven thing that Shatavari is a known galactogogue, but very few people know that even Durva, now we are going towards Bhadrapad. So in Bhadrapad, Ganpati ji, so we put Durva there. Durva is a wonderful galactogogue. We need to work on Trun Panchmul. Trun Panchmul help too much lactation. Causes of decrease in breast milk supply, as has been told by my previous speakers: caffeine, smoking, stress, alcohol, drugs, medicines, not taking proper diet. This diet portion is really troubling me also. My patients who have gone for Garbha Sanskar, the baby is of their choice, they're happy with the baby, but once the baby is out, the father says, baby's father says, that you have become so fat now, the baby is out, reduce your size, lose your weight. Why is he interested in that? He is not supposed to have sex. He's supposed to leave mother and child alone at least for 6 months. The government will give 6 months, 2 years, but if the husband does not give her rest, where is she going to go for rest and stress-free life, having enough time for her baby, having enough hygiene so that she can feed her baby timely and healthily? Husbands don't understand that, and no one pays attention to this point. And I am literally suffering. गर्भ संस्कार तो करवाएंगे, बढ़िया तरीके से करवाएंगे, और जैसे ही बच्चा हाथ में आता है उसको सेक्स चाहिए, तो बच्चा क्यों लाए भाई? Bottle is the worst thing we can give to the mother. That's the worst thing, and it's everywhere. It's in the doctor's prescriptions also. You see here, the slide said that she should take such nutritive food like banana, cereals, and there are अनार के दाने भी डाले हैं. But this, for me, is not the proper photograph. The mother is busy with the mobile. She has just put down those earphones and she's eating the food, probably because she is hungry. Where is the baby here? There is no baby here. This is the major problem here. There's too much talk about what a mother should do, what she should eat, what should be given to her, what government should do, give her this in a hospital or in a nursing home or in a kindergarten thing and all that. But no one tells the mother, please put the phone on one side. You have a 24 hours working factory with you. The factory is supposed to grow healthily, happily, and timely. If you can't take care of that, please don't beget. Please don't beget. 7 signs of a baby getting enough milk. The baby's weight is gained steadily. Wet diapers. I actually don't like diapers because they lead to napkin rashes. Natural latching. The baby will latch by itself. There is no need to make the baby latch. The moment the baby gets hungry, the baby will just remove the clothes and start sucking. Frequent nursing, softer breast, because whatever milk was collected in the breast has been taken by the baby. So, no question of any breast diseases. The baby remains happy, cheerful, keeps the family and atmosphere, environment cheerful. That is what we want ultimately. Visibly nursing mother. Mother is able to nurse the baby normally without any stress or any signs of stress, and the mother-child relationship is maintained. Thank you. Thank you very much.
Parulji, thank you very much. You have, as always, your slides are so informative and we enjoy this very much. We are coming up to we've just crossed our 9 o'clock deadline. Pavanji, I just want to take 1 minute to thank Professor Begum, who is joining us from Bangalore. Professor Begum is the Professor of Obstetrics and Gynecology in the National Institute of Unani in Bangalore. Namaskar ji. I wondered, it's the first time we have seen you in our platform, so this is a very warm welcome to you for joining us today from Bangalore. If you would like to make a few comments about what you have heard from our speakers today, Professor Begum, then the floor is yours. Namaskar. Welcome to our platform. We also wish you will continue to join us in future events and bring colleagues from the National Institute of Unani Medicine in Bangalore to contribute to our platform. The floor is yours, Professor Begum, if you would like to share a few thoughts. Namaskar ji. If Professor Begum is not able to connect or does not want to take the floor, then Pavanji, with your permission, shall I first of all, thank all the speakers for their wonderful presentations today. We have learned a lot. The point about the 30th breastfeeding week is about education and making a better connection with aspects of health and well-being. And I think this came through very clearly in our presentations today. I take the liberty of once again sharing the theme for this year's the annual campaign, World Breastfeeding Week. It is here, set up for breastfeeding, educate and support. And I think all our speakers today have taken us deep into every one of these points, revamping the capacity for actors and restoring breastfeeding support systems and connecting this with the sustainable development goals. And with those few words, I give the floor to Pavanji. Pavanji, perhaps Pavanji is not here, then I do what Pavanji would have normally.
I am here, sir. I am here.
Namaskar ji, namaskar. Pavanji, thank you once again for bringing all of us together today on this wonderful event. Very, very important that this message gets around, particularly the new information that is coming through
Yes, sir.
about the
Now session is open if anybody would like to say anything, sir. अग्निहोत्री सर, अग्निहोत्री जी के कमेंट के बाद सेशन ओपन किया जाए।
अच्छा
जी जी
नहीं, एक्चुअली
बेगम जी है हमारे साथ, बेगम जी से बाद में सुने अग्निहोत्री जी के बाद। प्रणाम जी।
नमस्कार सर, नमस्कार। अगर देखिए लास्ट तक लोग बचते नहीं, इट इज ओनली 10। तो अगर प्रोफेसर वाहिदा बेगम जी हैं तो फ्रॉम यूनानी साइड को कुछ अपना इनपुट देना चाहें रिगार्डिंग गैलेक्टोगॉग तो अच्छा रहेगा। बाकी डॉक्टर सीपी शर्मा जी हैं तो उनके पास तो वास्ट एक्सपीरियंस है ही। एंड देन आई विल मेक ए कमेंट। आई हैव कलेक्टेड द इंफॉर्मेशन फ्रॉम ऑल द 5 टुडेज गेस्ट स्पीकर्स, तो वो देख लीजिए अगर वो दोनों लोग में से कोई भी इंटरेस्टेड हो तो। थैंक यू।
थैंक यू अग्निहोत्री जी। शायद बेगम जी की माइक्रोफोन हो नहीं रहा लगता, पवन जी अनम्यूट हो नहीं रहा लगता। पवन जी के पास है कंट्रोल। प्रोफेसर बेगम नमस्कार जी, अगर आपसे थोड़ा सा।
I have asked to unmute.
अच्छा, कोई नहीं पवन जी। अगर शर्मा जी प्रणाम जी, अगर आपसे थोड़ा सुने आज की चर्चा के ऊपर।
पटानकर साहब और शर्मा जी।
हाँ, पटानकर जी भी है हमारे साथ। पटानकर जी से एक कमेंट आया कि दैट इज नीड फॉर द आवर। राजन जी प्रणाम जी।
हाँ प्रणाम प्रणाम। बाहर हूँ इसके लिए ये नहीं ऑन करता हूँ वीडियो पर कि ये जैसा मैंने इनपुट डाला था कि सच मुझे नीड ऑफ द आवर है, क्योंकि जो हायर सोसाइटी है उनके इसमें अभी भी एक गलत फहमियाँ है कि टू मेंटेन देयर फिगर, तो उसके लिए वो ब्रेस्ट फीडिंग नहीं करते हैं और उसकी वजह से लैक्टेटिंग ग्लैंड्स में ये तैयार होना कोई नोड्यूल्स, और उसकी वजह से गए 5-6 साल में अप्रोक्सीमेटली 12 से 15 मतलब गोइंग टुवर्ड्स ब्रेस्ट कैंसर ऐसे पेशेंट्स देखे। तो इसके लिए लैक्टेशन करने से जो बेनिफिट्स है वो आज के सोसाइटी में समझाना फिर से दोबारा जरूरत है। और ये समझाने के लिए आजकल न्यूक्लियर फैमिली होने की वजह से कि जैसे घर में सीनियर्स थे, दादा थी या आजी वगैरह, तो वो आजकल नहीं होने की वजह से उनको कोई समझाता नहीं है और वो हिसाब से वो फॉलो भी नहीं करते। तो इसके लिए आजकल के इसमें जो भी कैंसर का ये प्रमाण बढ़ने लगा है स्पेशली फीमेल्स में, उसके तरफ देखते समय ये भी एकदम इम्पोर्टेंट बात है ब्रेस्ट फीडिंग की। थैंक यू। ओवर टू मदन जी।
हरिओम हरिओम। आदरणीय सीपी शर्मा जी को नमस्कार।
सर प्रणाम सर, नमस्कार, नमो नमः।
नमो नमः, नमो नमः। कैसे
जी
हैं
सर, राधे। बढ़िया, बहुत अच्छे। आप सुनाइए।
बस बढ़िया सर।
हाँ, वर्ल्ड ब्रेस्ट फीडिंग वीक जो आप सेलिब्रेट कर रहे हैं अपने माध्यम से, इसके लिए मैं आपको पहले बहुत बहुत धन्यवाद देता हूँ कि आपके नए नए कंसेप्ट और प्रत्येक दिन को और प्रत्येक दिवस को, प्रत्येक सप्ताह को जो स्वास्थ्य से संबंधित है या पार्शियली हेल्थ से रिलेटेड है उसको आप सेलिब्रेट करते हैं। इसके लिए मैं पूरी टीम को, आदरणीय मदन जी, अग्निहोत्री साहब, सभी को बहुत बहुत धन्यवाद देते हुए जहां तक जो आज का थीम है, आज का विषय है, जिसमें हमारे सभी वक्ताओं ने बहुत ही गंभीरता से विषय की प्रस्तुति दी, इसके लिए सभी का साधुवाद। आयुर्वेद जहां दूध मिल्क के बारे में एक छोटा सा टुकड़ा मैं बोलूंगा, क्षीर जीवनीय नाम श्रेष्ठ। जीवनीय द्रव्यों में जहां हमारे वक्ताओं ने बताया कि हमें जो यदि लैक्टेशन बढ़ाना है, दूध बढ़ाना है माँ का, तो जीवनीय औषधियां देते हैं। जीवनीय द्रव्यों से का चाहे ग्रेन्यूल्स बना लें, सतावरेक्स है आपका, या अभी मैडम ने बताया रसौन, लहसुन की कल्प है, ये जो चीजें हैं ये निश्चित ही हमारी उस शारीरिक जो क्रियाएं हैं, मेटाबॉलिज्म और जो डाइजेस्टिव प्रोसेस है उसको परफेक्शन में लाती। साथ ही माँ का फिजिकल एज वेल एज मेंटल स्टेटस, माँ पूरी तरह से माँ बने, माँ के रूप में माँ को, जहां हम हमारे महर्षियों ने कहा क्षीर जीवनिया नाम श्रेष्ठ, फिर उसमें विकल्प भी दिए, माँ का दूध श्रेष्ठ है, उसके लिए एक समय सीमा निर्धारित है कि इस समय सीमा तक लैक्टेशन, मात्र दूध, धात्री दूध, इसका विकल्प दिया उन्होंने गौ माता। उसके बाद मान लो गाय का दूध भी उपलब्ध नहीं है, उसके बाद उन्होंने बकरी का दूध, बकरी का दूध की अनुपलब्धता में फिर अपन कोई सी भी मैसी दूध या दूध यूज कर सकते हैं। तो ये जो क्षीर जीवनिया नाम वाली बात कही, तो इस क्षीर के साथ, क्षीर के जितने विकल्प हैं आयुर्वेद के अनुसार, दूध, दही, घी, साथ ही जो संस्कार है, जैसे आपने दलिया बनाया, एक हमारे यहाँ गेहूं होता है विशेष प्रकार का जिसे कठिया गेहूं कहते हैं, उस गेहूं का यदि दलिया बनाया जाए तो वो भी हमारे लिए स्तन्यवर्धक है, माताओं के लिए स्तन्यवर्धक है। हमारे यहाँ माननीय मुख्यमंत्री द्वारा जो योजना चल रही है गर्भवती महिलाओं की, और गर्भ प्रसव के बाद एक तो लड्डू बांटे जाते हैं महिला बाल विकास के माध्यम से, वो जो लड्डू हमारे यहाँ पुराने प्रचलन में है, जिसमें हमारी पूरी औषधियां, जिसमें माता के पूरे जेनेटिलिया को करेक्शन के साथ साथ इंटरनल डाइजेशन प्लस लैक्टेशन इसको प्रेरित करती है, इसको प्रॉपर वे में लाती है। और माँ का जो मानसिक स्टेटस, मन से माँ वास्तव में स्तन्यपान कराए, और जो पोस्चर मैडम ने बताए, वो पोस्चर पर्टिकुलर परफेक्ट फीडिंग के लिए जरूरी है। चाहे हमारे दूध में, माँ के दूध में, या हमारे जो भी अंतःस्रावी ग्रंथियों, प्रोलैक्टिन वगैरह जो भी हमारे हार्मोन्स हैं, उनके स्राव के माध्यम से जो मानसिक इसको प्रेरणा मिलती है लैक्टेशन की। आपने देखा होगा माँ को एक ड्यूरेशन के बाद ऐसा लगता है कि अब मुझे बच्चे को दूध पिलाना चाहिए या बच्चा रोए। ये दो स्थितियों में स्वतः लैक्टेशन, स्वतः स्तन्यपान की इच्छा उसके जागृत होती है। वो ममत्व जिसको आयुर्वेद में अपन कह सकते हैं, माँ का जो विशेष बच्चे से शिशु से जो लगाव रहता है। आज की स्थिति में क्या हो रहा है साहब कि आज की स्थिति में फिगर मेंटेन करने के लिए या उन्हें कोई इस तरह का पहले से ही ड्रग भी हार्मोनल प्रिपरेशन और ये लोग दे देते हैं कि कम दूध निकले, दूध नहीं आए। तो वो जो अभी पूर्व वक्ता ने बताया कि वो ही हमारे ब्रेस्ट कैंसर के लिए कई बार बड़ा फैक्टर बन जाता है। तो हमें अपनी माँओं को, भाभी माँओं को या इस एज ग्रुप की लड़कियों को और जिन गर्भवती महिलाओं को स्वास्थ्य शिक्षा के माध्यम से स्तन्यपान का, एक स्वस्थ स्तन्यपान से स्वस्थ स्वस्थ राष्ट्र का एक नागरिक, स्वस्थ संतान तैयार होगी जो पूरी तरह से शारीरिक और मानसिक रूप से सक्षम और सशक्त होगी। ऐसा शिशु, ऐसा बच्चा, ऐसा बालक बालिका हमारे राष्ट्र का, हमारे देश का निश्चित स्वस्थ समाज का निर्माण करेगा। तो ये जो एक छोटी सी युक्ति जो बताई हमारे यहाँ आयुर्वेद में, क्षीर जीवनीय द्रव्य, जो वाइटलिटी, वाइटल कहते हैं ना साहब, ये वाइटल पूरा का पूरा एज ए होल पूरी बॉडी को परफेक्ट न्यूट्रिएंट्स उपलब्ध हैं, वह एक माँ का दूध है। माँ के दूध के अलावा जो भी विकल्प हैं, इन विकल्पों का भी अच्छा, हमारे यहाँ तो 8 तरह के दूधों का वर्णन बताया आयुर्वेद ने किया है, परंतु वो व्याधि और उनके गुणधर्मों के अनुसार उन आचार्यों ने वर्णित किया है। ये सब हमारा एक अपना खुद का जो कलेवर है, हमारा जो शास्त्रीय वो है, उसमें जहाँ आयुर्वेदो अमृता नाम, वहीं पर क्षीर जीवनीय नाम श्रेष्ठ। इस तरह के संदर्भ से हम क्षीर की, हम दूध की, हम स्तन्य की महत्ता स्पष्ट करने में कर सकते हैं। तो हमें अपना एक स्वास्थ्य शिक्षा पर आयुर्वेदीय तरीके से प्रस्तुत करने का हमारे चाहे वो हमारे वैद्य लोग हों जो डिस्पेंसरी में काम करते हों, या हमारे महाविद्यालयों में जो हमारे कौमार व्रत और प्रसूति तंत्र विभाग है, वहां पर भले ही हम वार्ड वाइज कैंप वगैरह के माध्यम से उनको इसके प्रति जागरूक करें और इसके मेरिट्स एंड डिमेरिट्स से उन्हें अवगत कराएं। धन्यवाद।
शर्मा जी, बहुत बहुत धन्यवाद जी।
सर
नमस्कार जी, वेरी वेरी नाइस। ये जो 8 तरह की दूध के बारे में पूरा दुनिया को पता होनी चाहिए जी, आयुर्वेद में क्या लिखा। कमाल की चीज है कि खाली हमें पता, मगर जी बाकी दुनिया को ये नहीं पता कि आयुर्वेद में इतनी साल पहले लिख रखा कि 8 तरह की दूध की प्रयोग कैसे, औषधियां जैसे।
जैसे सर उष्ट जैसे कैमिल कहते हैं ना, कैमिल का मिल्क ऑर्थराइटिस में, आम बात में, वातव व्याधियों में, कि राजस्थान डेजर्ट क्षेत्र था, उस डेजर्ट में वातव व्याधियों की प्रबलता अधिक होती थी और वो लोग रूखे में, सूखे में ही भ्रमण करते थे, धूप से पानी कम मिलता था। तो वहाँ आम बात में इसका भी विशेष उल्लेख किया है कि कैमिल मिल्क का अपन यूज कर सकते हैं। ऐसे ही अभ्यंग के लिए, वैसे तो वो अभिसंधि कहा है, भेड़ का दूध, जिसे भेड़ कहते हैं शीप, उसका दूध बहुत थिक होता है, गाढ़ा होता है, तो वो हमारे यहाँ अभिसंधि पदार्थों में काउंट होता है, जिससे स्रोतोरोध होता है, जो व्याधि का जनक होता है। परंतु हमारा उसको बाह्य एक्शनल एप्लीकेशन में, जहां हमें स्नायु दौर्बल्य है, जहां हमें अस्थि भग्न हुआ है, जहां हमें ज्यादा स्नेहन की जरूरत है वहां पर उसका और उसके घी का एक्सटर्नल एप्लीकेशन का प्रावधान। गाय के दूध के बारे में तो गाय के दूध को, माँ के दूध को तो अमृत ही कहा है, अमृत जीवनीय द्रव्यों में श्रेष्ठतम कहा। महसी दुग्ध कंपैरेटिवली गाय और बकरी, इस बकरी के दूध से तुलना में थोड़ा सा थिक होता है, गाढ़ा होता है, और जैसे कहते हैं आयुर्वेद में देर में उसका पाचन होता है। उसके लिए हमें उसे डाइल्यूट करना होता है। उसमें डाइल्यूट करने के बाद हमें, हमारे यहाँ इतना तक कहा उन्होंने कि आपको उसको गर्म करना है, प्लस उसमें मिश्री, शक्कर, शहद, गुड़ डालना है, तो वो आपको कोई भी वैकारिक अवस्था उत्पन्न नहीं करेगा। वो अपना जो उसका धर्म है,
डॉक्टर साहब आपका आवाज कट गया जी। चलो बहुत।
इसके अलावा सर बकरी का दूध, बकरी के दूध के बारे में सर हमारे यहाँ क्षय रोग, एक ट्यूबरकुलोसिस नाम की व्याधि होती है, उसमें आयुर्वेद ने बकरी के दूध का विशेष, इवन यहाँ तक कहा कि बकरी का मांस खाना, बकरी का दूध पीना, बकरियों के बीच में सहना, सोना, ये हमारे क्षय का जो बैसिलस है उस कीटाणु को नष्ट करता है। तो ऐसा हमारे यहाँ एक बहुत ही एक साइंटिफिक वे में सभी दूधों का वर्णन किया है हमारे चरक ने, हमारे आचार्यों ने।
बहुत बहुत धन्यवाद शर्मा जी। वेरी ऑलवेज आई एम हैप्पी शर्मा जी, ये जो बातचीत जो हो रहा जी आज हमें ले जानी है जामनगर तक, ये जो WHO वाले वहां तक ले जानी है ये।
नहीं बिल्कुल सर, बिल्कुल स्वागत।
प्रणाम जी।
धन्यवाद सर, धन्यवाद, प्रणाम प्रणाम।
हाँ जी, पवन जी, I request Pavan ji to take us forward. Otherwise, Agnihotra ji, pranam ji. If Pavan ji is not, if Pavan,
he is very much here. He is always here, and he watches us all the way.
Watching everything.
Yes.
नवीन गुप्ता जी एंटर हुए।
अच्छा, नवीन जी सुनने के लिए शायद। नवीन जी नमस्कार।
नमस्कार जी।
नमस्कार जी, सुभाष।
प्रणाम प्रणाम जी।
प्रणाम जी। मतलब जी आपको बड़े दिन बाद देखा आज हमने।
नहीं, आज बस थोड़ा सा, ये तो हम तो पवन जी की वो प्रोग्राम की उसमें पढ़ा कि पवन
जी तो यात्रा से आ गए क्या? कलकत्ता
पवन जी आ गया हरिद्वार से, अलग अलग पूरा यात्रा से बात। वेरी हैप्पी नवीन जी, आप थोड़ा सा लेट हो गया, पता नहीं कैसे आज।
हाँ जी हाँ जी।
सो रहे थे लगता?
नहीं।
अच्छा।
No. I was completely busy with because my eyes were tired because I was working lately on Zoom for many consultations. Anyway.
अच्छा, consultations चलो, बहुत बढ़िया जी। Anyway. आज नवीन जी हमारे साथ है प्रोफेसर बेगम बेंगलुरु से, नेशनल इंस्टीट्यूट ऑफ यूनानी से, और बेगम जी हमारे साथ है नवीन जी गुप्ता जी है, छात्र थे कहाँ पे? दिल्ली में जी, हमारी तिबिया कॉलेज में, आयुर्वेद पढ़े तिबिया कॉलेज में। सो वेरी लकी, ही इज अ वेरी स्पेशल पर्सन नवीन जी, ही अंडरस्टैंड्स बोथ आयुर्वेद और यूनानी सिस्टम, कि इलाज भी करते हैं औषधियों से, कि वो यूनानी वाले औषधियों से। सो नवीन जी, वी आर हैप्पी, दिस नेटवर्क मस्ट स्ट्रेंथन, हमारी यूनानी लोग मस्ट जॉइन अस, क्योंकि उनके पास भी है कुछ एक्सपीरियंस and very interesting documents है उनके पास, which we find difficult to read because everything is in Farsi or Urdu, but they have that understanding. So we should welcome all our Unani scholars also to our platform, and more importantly our Siddha scholars from south of India, who also have a very rich literature, but all that information is in Tamil, which makes it again difficult for us. So that we have an additional challenge of inviting scholarship and also giving them the space to share their wisdom. So with those few words, thanks, Begamji, बहुत बहुत धन्यवाद for staying with us so late. And thanks to Naveenji for joining us today. We are about 30 minutes past our schedule, Agnihotriji. Apologies for this. And for our viewers on YouTube, I just want to apologize for the poor quality of our sound for two of our presenters from Jorhat, from Assam Agriculture University. Apologies for that. We will make sure that the quality in these interactions will be better next time. Dhanyavad. Dhanyavad ji.
Agnihotriji sir.
Yes, sir. Namaskar. Thank you, sir. Namaskar. So we are here to celebrate our 460th webinar today. First of all, I would like to extend my regards to all the great dignitaries who joined today's webinar. And we are starting with Professor Manthan Thangwaluji, Professor B.P. Sharma ji, Dr. Pawan Kumar Sharma ji, Dr. Tejinder Jagdishwar Doma ji, Ved Jayesh Thakkar ji, and Dr. C.P. Sharma ji, Dr. Parikshit Devnath ji, Dr. G. Sophie ji, Professor Wahida Rahman Begum ji, Suji ji, Momita Sharma ji, Dr. Mallikarjun Rao ji, and lastly, Dr. Ved Naveen Gupta ji, along with our great guest speakers, starting with Dr. K.C. Priyadarshini Gundaratne ji from Lanka, and Dr. Shilpa K. Yari from Solapur, and Dr. Manisha Chaudhary from Jorhat, Assam, Dr. Pamela also from Jorhat, and Ved Parul Joshi ji from Gandhinagar, Gujarat. Of course, there was a little bit network speed problem, so we could hear in a fragmented manner. But we are happy that our webinar has got an expansion to the agriculture university belonging persons. So it's a good achievement. Though I am sorry that it is only hardly 16 maximum attendance of today's webinar, while it should be uncountable, because we are all living out of that breast milk. So it is so vital and it is so important that maximum could have joined. Our guest speakers might have joined 10 persons at least, so that it would have touched the half century. But still, as Dr. Pawan Sharma ji brought a very new topic, though it is running for last 13 years with the help of the direction of WHO, along with each and every school, college, girls degree college, our medical colleges and Ayurvedic colleges, and everywhere, wherever the females are working, it may be LIC, it may be aeronauts, everywhere females are there, and this issue is always vital, and it should the approach towards its awareness for the breastfeeding is always a very, very important point. It has got no end. It has got no end point. So we are always there to promote it by any means. So our first speaker, now I'll start with our comment that our first speaker was Madam Gundaratne ji, and she very elaborately, we have also heard her earlier, she in a very detailed manner talked about the anatomy and physiology of breast as a part of body, and again the types of nipples, the types of areola, the size of breast, and the convenience and conduciveness of the breast as per the feeding purpose, along with the role of and influence of hormones for this lactating, with a great deep knowledge to the cause which we took forward on today's webinar. And again, Dr. Shilpa Yarne touched the area which was important regarding the breastfeeding, because the lacking of this issue is, see, though this point is raised by females, lady doctors, the area which is means supposed to be responsible and its effect is pertaining is again the females, and the ignorance or the avoidance is also made by the females. So overall, where we have to, we males have got no role in that way. It is the female and lady doctors to whom across the right from the childhood the female child comes, and to the lactating mother. The whole area is being covered and supposed to be guided by the our lady doctors with a special importance of this breastfeeding, because it has no alternative to its at par. There are alternatives said to be alternatives, but it has got the mother milk has got its independent milk protein. It has got a convenient concept which has been covered by all our great speakers. No filter needed, no boiling needed, no feeder needed, no preservative needed, no sugar is to be added, nothing doing. So convenient, but you have to manage your health. You have to make all efforts for its proper production as per the choice and need of the baby. So it has been covered by Dr. Shilpa also. So goes the case with the Manisha Chaudhary's address. I was scared a little bit till her address. We were just waiting for the Galactogogue, which was a topic which was assigned for today. That AYUSH Galactogogue, or if Madam Wahida could have come forward, the Unani Galactogogue. Then we have been more informed by the end of the webinar. But still, that covered by Dr. Parul, as Mallikarjun was talking about that one, and we have a personal chatting. So she came forward. I, with full folded hand and with the deepest of my heart, convey my sense of regard to Vaidya Parul Joshi's favor, because we have heard her so many times. Her approach towards the academy, towards the literary part, towards the clinical part, towards the research part, and again administrative part, and then the frankness over all such topics like Push Dhanvaras or couple cases. She always come with so many her personal experiences along with the instances or examples from Gujarat or her own college. That makes the decency and depth of her speech. She covered all the areas, and so many times she underlined so very, very important point, which I like to appreciate. That one is right from the planning of pregnancy, the hygiene and status of breast should be taken care of. This is one very, very important thing which is always ignored, or person don't feel. Even the would-be mother never feel of it. Whatever is going on, it is happening. When the time will come, it will be seen. This is not, it should not, one should not be so reluctant, because right from that day, the 22 pair lactiferous tubules will start walking. So it's very important. And again, the second point which she raised, that an ultrasonography to be performed for the well-being of the fetus, which also indicates that if the fetus development is not proper, the gradual or the simultaneous or the rational development of breast will not take place. This is interconnected concept. This is very, very important. A person will face a crisis when the milk will not be there, but when the time was there, it was not taken into consideration. So that is very, very most informative address made by her, and she touched all that area, that what is lesson, what is adrak, in what way things can be done, how she is capable to manage the ladies coming from the Jaina Dharma followers. This is very important. She touched all the such areas, and latch is also been touched by her. This is very important. Oversized, undersized, improper position of the baby during the feeding, frequency of feeding, interval between the thing, rest for the mother, for the development of proper quantity of milk, everything, every side she touched in that way. And what I found, that total area, even she talked about the contents and quantity coming from the rice press, quantity coming from the left breast, and the concept related with this with our text is very important, that if a male is delivered, father is supposed to come forward with the ceremony of the presence of the all family members. He should ask that the feeding should be started from the right breast. How technical these things are there, and never it has been taken in anybody's mind. And if the daughter is born, the feeding should be started from the left breast in the same celebration manner. And this time, I just remembered thrice the issue which Professor Madan sir you raised regarding the Shishri Chir, as far as the 9th chapter of Unman Chikitsa, the Mahakalyanak Tel is being prepared for the Bhutonma Chikitsa. That is the time that apart from colostrum, could it be anything important that the microRNA is also differing in this very first milk? If the ladies deliver the first issue, very important. This is the sector. I do remember that concept. But overall, rason chutney, tilgul, everything, groundnut preparations, these are to be given in a very healthy, as a very healthy diet. And she also pointed out that the Rajasthan roadside labor class ladies delivering the proper healthy child, but because of the lack of proper diet to the mother, after say 3, 4, 5 months, the baby getting under the category of malnutrition. So this is one thing to be taken care of by the government, by the society, by the NGOs, so that every child who got the earth, who got birth on earth, as she told that almost in say 180 days or so, some 40% or more babies getting malnutrited if not given proper feeding, because first 6 months are chirad. They are completely dependent upon the milk feeding. If it is good, if it is natural from the mother, or as a substitute from cow diluted another one. Then came the time of panel discussion, which was started with our professor, Dr. C.P. Sharma Sahab. Apart from his experience, what I'm going to touch, Dr. Pawan Sharma ji and Dr. Naveen ji, those who are coming from India, Dr. Professor Madan sir himself also, and those who are coming from the belt of Indore, Bhopal, Madhya Pradesh, I mean Bihar, Uttar Pradesh. I'm going to recite something very important, which is completely referential to today's webinar's topic. That as Dr. C.P. Sharma told, that with the government's approach in MP, the Laddu, Mahila Bal Vikas, under this umbrella of Mahila Bal Vikas, the Laddu, Modak, they are prepared and distributed for the promotion of the lactation to the lactating mothers. For that, there used to be a ceremony in our all rituals in our homes. When a baby is delivered, there used to be so many preparations like harira, panjiri, and laddu, katli. Also, so many things are there made up of this mawa, khoa, or other so many things. For that, there is a very good song in a local language. I do hope that you will all follow, and how nutritious it is, and in what way it is conveying the message. I'll just try to recite that one because it is most referential. Two Saheli, two ladies talking amongst us on the occasion of a ladies program after a delivery. So they are enjoying the occasion and talking about them, but it was a little bit taunt that how should we manage and how it is important. Soth ke laddu char pare, soth ke laddu char pare se. Dr. Pawan is here. Pawan ji, listen to me. Soth ke laddu char pare se means soth means the powdered form of the dry ginger. Soth ke laddu char pare se. गरी के गोले 9 पड़े हैं, पसेरिन इनमें मेवा पड़ी है, आधो देत मेरी उंगली दुखत है, पूरो दयो ना जाए, सोंठ के लड्डू चर परे से.
The concept in English is this, that we have prepared this laddu out of the dry ginger powder, and we put 9 coconut powder material along with some dry fruits. So it's very delicious, very costly.
अग्निहोत्री जी, वो गोंद का जिक्र किया आपने, गोंद का।
अरे, when I talking about the almond, apricot, गोंद, of course, गोंद after making it dry with the देसी घी, भून के पाउडर बना के, सूंठ पसेरिन, when I talk the पसेरिन, इनमें मेवा पड़ी है. When we talk 5 kg, 5 kg dry fruits are there. So including khaskhas, goand, apricot, this walnut, everything is there. So, and it is so tight because of this goand. Without this gum, it is so tight that if you are interested to deliver it, to distribute it among the ladies, half, so you cannot break it because it is very tight. So, आधो देत मेरी उंगली दुखता है. If I try to put the finger to break it, it is difficult and it will ultimately sustain the pain over the finger.
पर इसका एक मतलब और भी है, इसका एक मतलब और भी है,
पूरा दिया नहीं जाए, because we cannot afford to give the whole one, because I will be in loss, because it is made for that lady who has delivered the baby, and for her it is very nutritious.
आपका बहुत
for the sake of token I can give half, but it is very difficult. So we have to use the stone to break it.
आपका बहुत बड़ा मतलब मैं इसको मिस कर गया. Thank you very much.
I can repeat it. Now it will be a property of archives. सोंठ के लड्डू चर परे से, सोंठ के लड्डू चर परे से. When we are waiting up to 9:45, naturally this is my time to speak.
I'm just saying that I will take only 1 minute. That's it.
Oh, yeah. Let me complete. Let me revise. गरी के गोले 9 पड़े रे, गली के गोले 9 पड़े हैं, पसेरिन इनमा मेवा पड़ी है, आधो दे तुम्हारी उंगली दुखत है, पूरो दियो ना जाए, सोंठ के लड्डू चर परे रे. Now you got the point?
Yes,
this is what by today's, this is the greatest galactogogue of Ayurvedic system of medicine, along with the jaggery. Gud is also there. We don't promote the sugar, white sugar, may it be brown sugar or it may be mishri. And with the help of that chasni, along with your suggestion of gum, that gum acacia, it is very nutritious, very costly, very important for the greater cause of the lactation, proper lactation for the progeny. So with these all words, I thank all these persons who joined today, and our greetings and our well wishes to all our great speakers. They enlightened us, and regards and thanks to all you big guys as you joined today. Professor Namidan Sirji, Professor Dr. Ved Namin Gupta ji, Dr. C.P. Sharma ji, Ved Rajan Patankar ji, Dr. Pawan Sharma ji, and all those who joined today's webinar. Thank you so much. Thank you. Namaskar.
Thank you very much. Thank you very much. Good night, sir.
Good night. भले हमारे लड्डू पे तो बोल दिए कुछ.
अरे लड्डू तो गजब. मेरे को तो हमारे यहाँ बिस्वार के लड्डू बोलते हैं उनको. बिस्वार के लड्डू.
बिस्वार. वो क्या उसका मेन इंग्रेडिएंट क्या है?
लड्डू होते हैं.
मेन इंग्रेडिएंट क्या है? देखिए जो पानी पिलाते हैं
गोंद और सौंठ.
सौंठ ना. हाँ यस.
हाँ गोंद और सौंठ.
गोंद और सौंठ. और जी आपको बता दूं, मुझे आप लोग भ्रम में मत रहना कि मैं लंदन में रहता हूँ.
कोई भ्रम नहीं है. आपके पास लंदन जाने का वीजा है. मान लो भ्रम में नहीं है. हम भ्रम में नहीं है.
आप भ्रम में मत रहना कि मैं मतलब मैं भारतीय नहीं हूँ.
आपके नाना जी आए थे. आपने बताया आपके नाना जी आए थे. आप तो वहाँ नरेला में से जुड़े हुए हैं.
मेरा तो पूरब पर दिल्ली 6 का हूँ. आप तो दिल्ली 52, तो दिल्ली 6 के हो गए भी नहीं. मैं दिल्ली 6 का हूँ. अच्छा दूसरी बात, मेरी पत्नी जब हम लोग जर्मनी स्विट्जरलैंड में 40 लड्डू बना के हमने कितने पेशेंट्स को दिए हैं आप अंदाजा नहीं लगा सकते. और
कमाया कितना?
मतलब 40 लड्डू हम देते थे करीब 200 यूरो के. तो 200 समझ लो 60-70 यूरो का रुपए का होगा उस समय. तो मतलब समझ लो आप कितने के दे दिए, जो भी है ठीक है बस। लेकिन 200 तो बहुत कम है यहाँ पे, यहाँ के तो कुछ की नहीं है वो,
हिसाब लगाना मुश्किल है।
हाँ यहाँ तो एक्चुअली चक्कर क्या है, यहाँ पे पेमेंट टाइम की है, वो लड्डू की थोड़ी कीमत है। लड्डू तो बनेगा 10 रुपए का।
नवीन जी, ये जो लड्डू आपने बताया, किस चीज का लड्डू बनाया जी आपने? इसमें
वो 2-3 जी, ये देखो मदन जी, मैं यहाँ
जी।
से आपको लंदन से लेके दूंगा, आप आओगे घर तो खिलाऊंगा ना आपको मैं, क्या बात होगी? ये थोड़ी मतलब क्या आप नहीं खा सकते?
नहीं इनको
रेगुलेट करता है।
लैक्टेटिंग मदर को खिलाना है, इनको क्यों खिलाएंगे?
अरे
इनको
इनको
दिखाना
भी
खाली।
खिलाएंगे। अरे कमाल कर दिया आपने। पवन जी से पूछो, जब औरत
इनको
लड्डू
दिखाना
खाती है
खाली,
तो
इनको दिखाना।
आदमी भी खाता थोड़ा सा उसमें से।
नहीं,
क्या
हम
बात कर
खाते
दी
हैं,
आपने?
हजीरा पंजीरी खाते हैं।
हाँ, क्या बात कर दिया आपने? जब औरत खाती थी पूरा लड्डू तो थोड़ा बहुत ही आदमी को मिलता था।
अब बनाने वाले को तो मिल ही जाता बचा खुचा।
और क्या। अरे परात में, पीतल की परात में बनता था, 40 लड्डू बनते थे, एक प्रतिदिन एक के हिसाब से।
जी 40 दिन का।
हाँ जी,
नॉर्मल प्रिपेरियम के लिए 40 डेज का, 45 डेज।
हाँ जी, वो हमने पूरे सिद्धांतों का उपयोग किया जी यहाँ पे, विदेश में रहने के बावजूद भी।
और स्वाद को भी प्राथमिकता दी।
आज भी हमारे घर में बिहारी जी को सुलाने के बाद सोते हैं। आज भी बिहारी जी को नहला धुलाने के बाद हमारे घर में सब काम होते हैं। आज भी यहाँ पे लंदन में भी और बेल्जियम में भी और स्विट्जरलैंड में भी हर जगह पे मंदिर है हमारे, बिहारी जी बैठते हैं हमारे घर में।
पवन जी भी अपने भोलेनाथ जी को साथ लाए थे, पूरा मंदिर।
अरे वाह जी वाह,
अलग उनका चल रहा था घर में पूजा, नीले फूल और बेलपत्री, पूरा पूजा लेके आए थे।
पवन जी का तो मैं जो वो सुनता हूँ वो तो मैं सुनता ही रहता हूँ बस। वो जो क्या कहते हैं, वो भजन गाते हैं शुरू में, मजा, उसका आनंद सबसे बड़ा आनंद आता है जी। और अभी ये मुझे नहीं पूरा फंक्शन अटेंड नहीं किया, लेकिन जो आपका पंजीरी वाला गाना था ना, इसने तो बस पूरा बता दिया मुझे क्या हुआ होगा।
पूरे का मजा ले लिया आपने। असली थीसिस में लास्ट में ना वही सब तो देखा जाता है, लास्ट समरी और कंक्लूजन देखा जाता है, वो आपको मिल गया।
नवीन जी, हम भी ज्वाइन हो जाएंगे।
अच्छा जी, वाह जी वाह। लड्डू खाने के लिए क्या लड्डू बनाने के लिए?
बनाने के लिए
नहीं, ये बना के आपको भेजेंगे, आप इनको फिर पेमेंट भेज दिया करना, तो ये एक अच्छा चैट हो जाएगा।
तो वो इंडिया वाले इंडिया से पेमेंट करवा देंगे इनकी, कोई बात नहीं। ठीक है जी। अच्छा जी, नमस्कार जी।
उसका मुनाफा हम लोगों को भी बट जाएगा कुछ परसेंटेज।
जगदीश्वर जी बोल लिए।
नहीं, वो आज नहीं थे सर, शुरू में थे। हाँ, आ गए हैं, जो हैं इसमें जुड़े हुए हैं, ले लीजिए उनके विचार ले लीजिए जी।
आपके कंक्लूडिंग रिमार्क जगदीश्वर जी, आदरणीय जगदीश्वर जी।
दुमा जी शायद
हाँ दादाजी, नमस्कार सभी को, मेरा विनम्र प्रणाम।
नमस्कार।
बोलिए।
दुमा जी नमस्कार।
हाँ नमस्कार मदन जी। यह माता का प्रेम जैसा ही मुझे सुनने में आया, तो माँ का प्रेम जैसा ही शिशु पर होती है, खुद स्राव हो जाता है स्तन से दूध। इसका एक थोड़ा सा रेफरेंस देता हूँ कि कृष्ण के लिए जब पूतना को भेजा गया था कंस ने, तो पूतना का 6 महीने पहले ही अपने बेटी या बेटा ऐसा खो गया रहता है, मर जाता है। जब स्तन में विश्लेप कर करके कृष्ण को मारने के लिए भेजा गया था, तो कृष्ण का सुंदर देखते ही पूतना का इतना भाव हो उठा कि दूध पिलाना। दूध तो स्रावित हुआ, लेकिन पूतना ये नहीं चाहती थी इतना सुंदर लड़का को कैसा मैं मानूं। तब जब जो है उसके आनंद से, वो कृष्ण का रूप देखते ही आनंद से जो स्रावी हुए सो दूध पिलाने जाती है, तो दूध पिलाने गए सो समय पर वहां पर अपने यहाँ तो ऐसा लंबी चौड़ी माने एक कहानी जैसा बताते हैं, वास्तव में वहां पर एक स्त्री जैसा जब स्राव हुआ, स्तन दूध स्राव हुआ, तो तुरंत उनके मुंह में दे देते हैं, कृष्ण के मुंह में, लेकिन ये नहीं समझती कि वो विश्लेप कर लिया था। और जब ये दिया तो कृष्ण ने, वो तो कड़वा कड़वा ही रहेगा, जो विश्व पदार्थ से करे सो, मीठा जैसा तो नहीं रहता, चॉकलेट जैसा तो नहीं रहता। तो कृष्ण उनका निप्पल काट देता है। जब काटते ही वो पूतना के अंदर वो जो पॉइजनस रहता है वो पहुंच करके उन्होंने मर जाती है। ऐसा अपने लिए तो बता देते हैं, उन्होंने एकदम खून खींच दिया, उनके रगों से निकल गया, वो निकल गया, उन्होंने इतने लंबी चौड़ी दांत से गिर पड़ी, ऐसा तो कुछ नहीं है वास्तव में। वो एक आर्यंस सब जो नानारियंस को बोलते थे राक्षसी, और वो तो नानारियन रिप्रेजेंटेशन थी, इसीलिए राक्षसी स्त्री बोला जाता है। तो पूतना का उतना प्रेम हो उठा था, लेकिन वो नहीं चाहती थी कृष्ण को मारने के लिए। माने यहाँ पर लड़का को देखते ही माँ का स्तन से जब दूध स्रावित होता है, उसका एक सुंदर से भवानसी यूनिवर्सिटी वाले ने कृष्णावतारा जो रिलीज करे, उसमें एक्चुअल प्रैक्टिकल ऐसा एक्सप्लेनेशन किए हैं। धन्यवाद।
रामचरितमानस में भी जगह जगह आया हुआ है कि जब भी ये राम लक्ष्मण भरत शत्रुघ्न अपनी माताओं के पास पहुंचते थे तो उनकी चाहे कोई अवस्था हो गई हो, चाहे शादी हो गई थी, लेकिन एकदम से उनको दूध श्रवण होता था। जब वो वात्सल्य आता था, रघुकुल तिलक जोर दो माता, मुदित मात पद नायो माथा, माता भरत गोद बैठारे, आस पहुंच नैन छुआरे, जैसे ये भाव आता था। तो आपने जो वात्सल्य बात की वो बिल्कुल सत्य है। त्रेता युग में यही था, मन भावते धेनु पय श्रवण ही, श्रवण होता था दूध का, उसमें सक्शन की भी नौबत नहीं आती थी, अपने आप से इतना स्पॉन्टेनियस होता था वात्सल्यता के कारण। धन्यवाद सर।
अग्निहोत्री जी, मदन जी सिर्फ आधे सेकंड के रुकना, मेरी पत्नी को बुला रहा हूँ। हेलो,
लड्डू है?
हाँ, मेरी पत्नी को बुला रहा हूँ, और वो ये इनका नाम श्रीमती रश्मि गुप्ता है, और ये आप लोगों को निमंत्रण देना चाहती है लंदन के।
लड्डू की व्यवस्था है कि नहीं है?
हाँ जी,
लड्डू और बर्फी सब बन जाएगा जी। नमस्कार।
नमस्कार नमस्कार जी।
लड्डू भी बन जाएंगे, बर्फी भी।
ये आप, इनको पता नहीं किस लड्डू का जिक्र हो रहा है।
अब आप अगली पीढ़ी की व्यवस्था में लड्डू बनाइए। अगली पीढ़ी के बच्चे के लिए की व्यवस्था होगी तो लड्डू खाने को मिलेंगे, सोंठ वाले।
अब इनको असल में बिल्कुल भी नहीं पता कि आज का प्रोग्राम कौन सा है। मैंने सिर्फ आपको अभी लड्डूपन जिक्र करने के लिए नहीं, केवल आपको सबको आमंत्रण देने के लिए मैंने इनको
बताना चाहिए था आपको पहले से। आप भी ने लेट ज्वाइन किया, इनको तो बिल्कुल लास्ट मोमेंट ज्वाइन कराया।
ये तो मतलब पूरे बस ये जी, बस आज मैं भी उसमें था, तो ये मतलब ऐसे उसमें थी। तो आप सब लोगों को अब निमंत्रण कर दें।
हाँ जी, आइए,
आप सब लोग आइए, लंदन में आइए, हमारे घर पे आइए। पवन जी आइए, अग्निहोत्री जी, राजन जी,
शुक्रिया, बहुत शुक्रिया।
आपसे पहले तो मदन जी आ जाए तो वही बहुत है, वो तो बहुत दूर रहते हैं ना हमसे मदन
नहीं,
जी।
वो सबके हिस्से का हम लोग तरफ से खा लेंगे, कोई बात नहीं।
नहीं, असल में मदन जी बहुत दूर रहते हैं, जरा 7 समुद्र पार रहते हैं।
नहीं, आपके तो पास हैं,
तभी तो मैं कह रहा हूँ बहुत दूर है।
अच्छा, आप व्यंग कर रहे हैं। देखिए, मन में भाव हो, पवन जी हमारे यहाँ आ गए, वो भी 1800 किलोमीटर से आए भाई।
देख लो
ऐसा नहीं है, तो आने को तो अब मन भर के मिले, हम लोग मन भर के मिले।
हाँ,
मन भर के
नमस्कार
जी। बहुत बहुत धन्यवाद सभी को। कल मिलते हैं 6 बजे।
ठीक है जी,
अच्छा, बड़े थैंक यू। गुड नाइट।